Good morning, everyone, and welcome to today's meeting of the Perth and Kinross Integration Joint Board. And to members of the public and our media listening to this live stream or to the post-meeting recording, you too are very welcome. This technology in Microsoft Stream enables full public accessibility to today's proceedings, and I am thankful to the press for their attendance today, as their role is vital in informing the population of Perth and Kinross of important health and social care matters. Following the First Minister's announcement yesterday, I do hope that the virus remains sufficiently under control and that we shall return to a normal physical meeting when we next meet in September. Before I ask the clerk to take a roll call of members, can I just remind everyone that this meeting is being recorded. The questions and comments on the chat function are accessible by Freedom of Information, and so please restrict your comments there to indicating you wish to ask a question or answer. Okay, so Scott, can I ask you please to move to the roll call of members?
Thank you, Chair. Good morning, members. Just to confirm, we have apologies from Ronnie Erskine, from Bernie Campbell, but we have Maureen Summers substituting. We've also got apologies from Alan Drummond, Sarah Dickey, Lisa Simpson and Diane Fraser. When I call out members' names, if they could just indicate that they're present. Councillor Duff.
Present.
Councillor McDade.
Present.
Councillor Purvis.
Present.
Bob Benson.
Present.
Peter Drury. I think Peter possibly was having some connection issues, so we'll come back. Pat Kilpatrick. Don't think we've got Pat. Gordon Patterson.
Present.
Jane Smith.
Present.
Jackie Pepper.
Present.
Dr. Robertson. Do we have Dr. Lee Robertson? Don't think so. Stuart Hope. Don't think we have Stuart. Sandy Watts. Do we have Sandy? Don't think we have Sandy. Sandra Auld.
Present.
Thank you. Lynn Blair.
Present.
Thank you. I can also confirm that we have in attendance Karen Reid, Chief Executive of Perth and Kinross Council. We're hoping to have Grant Archibald, Chief Executive of NHS Tayside, join us shortly, but he's just having some connection issues. And we have a number of other officers from both the Health and Social Care Partnership and partner organisations. Thank you.
To say that I'm present, Maureen Summers.
Thank you, Maureen.
Thank you, Maureen.
Okay.
And now, talking of Karen Reid, you have a question.
Thank you, Chair. Good morning, everyone. Chair, my apologies. I may have misheard you. Can I just clarify if you said the next meeting of the IGB in September would be a physical meeting?
No, I simply indicated an aspiration that it may be.
I hope so, but we won't really know until after the 14th of September, but we'll certainly do our best.
Indeed.
Thank you, Chair. Thank you.
Thank you. And Bob Benson.
Just to advise that Norman Pratt, who was our proxy representative for Ronnie Erskine, has just given his apologies due to operational requirements in NHS Tayside.
Okay, thank you. I appreciate that, Bob. Thank you very much. Okay, so without further ado, I'll move to item 2 on the agenda, which is declarations of interest. And now, if anyone has a declaration of interest in respect of any of the items on today's agenda, can they please type DI into the meeting chat? I'll give you a few seconds to do that. Okay, there are no declarations of interest, so thank you for that. And therefore we'll move on to item 3 on the agenda, which is the minutes of previous meetings of the Perth and Kinross Integration Joint Board. And the first of these is the minute of the special meeting on 21st April 2020. Does anyone have any comments or questions on the draft minute? If so, please type Q or C in the meeting chat. No, we don't appear to have anything there, so can I take these as read? Silence will, or no comment on the chat will confirm that these are approved. Thank you. These minutes are approved. Moving on to the next minute of meeting of 29th May. Again, can I ask for any questions or comments by typing a Q or a C in the meeting chat? Okay, again, we have no questions or comments.
I can't do it. I'm trying to put question in here.
Okay, Maureen, if you want to fire away with a question. Do you have a question, Maureen?
Can you hear me now?
I can hear you now, Maureen. Yeah, fire away with your question.
It's under the list of people present at that meeting, under stakeholder members. They have Maureen Summers substituting for Miss Bernie Campbell. If it could be noted that I only attended by telephone. I wasn't actually, virtually present at the meeting. I was only at the end of a telephone for that meeting because of IT problems. So it did make a big difference to me, maybe, but okay, that could just be recorded. Thank you.
Thank you. Okay, if there are no further questions or comments, these minutes are also approved. And now, if we can therefore move on to item 4 on the agenda, which is an action points update, although much of the content I think is reflected also in paper 10 that we're going to be looking at today. But can I ask Gordon Patterson to give a brief update, please?
Thank you, Chair. I think, as you've indicated, the action point update has over time evolved really into capturing a schedule of future reports, so it is very consistent in terms of its purpose with item 10. However, there are probably some inconsistencies in terms of the timings that we're proposing. So if the IJB were minded, I would propose that rather than focus in on this document, we wait to discuss the future schedule of reporting at item 10. I think we need to reflect on how we better capture action points as they arise in IJBs for future action. And I think there potentially can be a bit of confusion around the distinction between action points and matters arising. So I think most of the information in this version of the action point update is, as I say, included in the schedule of reporting that we have at item 10. So can we perhaps just discuss the reports that are coming forward to future IGBs at that item?
Okay, thank you, Gordon. And Councillor McDade, you have a comment?
Thank you, Chair. Thanks, Chief Officer. Yeah, I'm very pleased actually about your explanation there, Gordon, as to how things end up on the action point list, because a number of times I've raised points around the risk sharing agreement and the joint working agreement, which have been minuted, and other similar things that have been minuted, but obviously haven't then been put into the action point update. So I wasn't quite. I couldn't quite understand why they were in the minutes, but then they weren't in the action point update, but you've just explained why that is. Is it possible for you to give us an update on those two, please?
Certainly, yes, I can do so. In relation to the risk sharing agreement, there has, I have to report, been little progress. I know that will be potentially a source of some disappointment to IGB members, given the ambition to better reconcile the current risk sharing agreement that we have in Perth and Kinross, perhaps with those that exist in Angus and Dundee. It has to be said that though is perhaps more a reflection on the focus that we've been given to COVID-19 and other activity, rather than any reluctance to explore that. It's also worth noting, I think, that it is more likely now that we will be addressing and seeking to reconcile this matter in the context of the review of the integration scheme more broadly. We know that 5 years on, there's an expectation that the integration schemes across Scotland will be reviewed and a revised version submitted to the Scottish Government for approval. So that, for me, would be the opportunity for us to address this issue. In relation to the joint working agreement, I recognise that there has been a keen interest in making progress on this item, and yourself, Councillor McDade, and Karen Reid, the Chief Executive of Perth and Kinross Council, have highlighted the need to do so. On the back of our last meeting, was able to secure some information from Alan Drummond in relation to the staff side view of the challenges around developing a shared and joint working agreement. Ostensibly because their ambition would be for us to achieve that across the three health and social care partnerships, the three councils and NHS Tayside, essentially a once for Tayside agreement. This matter, though, has been escalated to the Area Partnership Forum of NHS Tayside, which is chaired jointly by Jenny Alexander and Grant Archibald, and they have requested that the matter be progressed and resolved. So the head of HR in NHS Tayside has been seeking to have a meeting with the three chief officers in order to make progress and secure agreement across the three partnerships. Obviously, we would then be going back to the councils to ensure that they were content with what was being proposed. Unfortunately, Christopher Smith from HR has been unable to get the three of us in the same room during the month of July because of annual leave and other commitments. So to reassure you that there is a growing appetite to resolve this and with pace and urgency, both because our IGB has raised it, but also now because NHS Tayside's Area Partnership Forum are minded to do so. So hopefully we'll see some good progress in the next few weeks in that regard.
Thanks, Gordon. And it does sound like there is now some movement on the joint working agreement. That's positive. I like your ambition that we're going to get a resolution as we review the integration scheme, but having sat in these meetings for over 3 years now, and since we've not managed to resolve it in 3 years, I'm not really sure if we're going to be able to resolve it by the end of the year, but I do like the ambition, and I'm pleased that there is some movement on the joint working agreement, so thank you for that update.
Thank you, Councillor McDade, and nothing wrong with ambition. We shall strive to the utmost, as they say. So thank you for that. If there are any further comments, I don't think there are at the moment, but if there are, this is the last call for comments on this item on the agenda. No? Okay, thank you for that. And can we agree to note Gordon's brief report? Thank you. Okay, just before I move on to the next item on the agenda, can I just check whether we have managed to get in touch with Grant Archibald and whether he's been able to join us? Is there any, Audrey, are you behind the scenes there? Are you able to tell us whether we've been able to get in touch?
Somebody has just joined us on the phone.
Okay, I'll leave it with you just now.
Hello?
Hello.
Hello.
We're getting some interference here. There's a telephone number come up.
It's Pat trying to join the meeting. I can see Gordon live, but I can't participate in the meeting. I can see everybody, but I can't participate. So I've had to join by call.
Okay, Pat, I'm sorry to hear.
To interrupt, Eric.
Yeah, sorry to hear about difficulties again. But yeah, you're very welcome to the meeting. Obviously,
I'm here in spirit, and I can see everybody, but I just can't. I can't interact with the Microsoft Teams, so I've joined it by call.
Okay. Thank you. If you would go to mute, but if you can, if you have questions or comments at any point, I'll see your telephone number popping up there, okay, and I'll come to you.
Okay. Thanks, Eric.
Thank you.
Councillor Drysdale, I've had an email to advise that Grant is watching the meeting live. However, he is unable to get into the meeting, so I would possibly suggest that he should phone into the meeting if he can.
If he's able to do that, obviously. Again, disappointed that hasn't been resolved. I did ask for that to be resolved yesterday. But if he can't come in, he can't come in. And yes, if he could do as Pat Kilpatrick has just done and dial in, that would be helpful, because I would really value Grant's input at the appropriate stage. So we're coming to the substantive items on the agenda, but the first one is about the IGB finance. So if during that item, if we can manage to get Grant on board, that would be great. Thank you. Okay, so without further ado, moving on to item 5 on the agenda, matters arising, and the finance update. So on this, can I ask Jane Smith, our Chief Financial Officer, to give a verbal update, please?
It's okay, thank you.
Maureen, sorry, you're on. Your microphone is on.
Sorry.
Thank you, Chair. Good morning, everybody. Colleagues will recall that an update on the potential impact of COVID-19 on the IGB's financial position was submitted to the meeting at the end of May, and an initial gross estimate of forecast costs for 2021. It was set at £7.1 million at that time. However, the full impact of COVID-19 on the IGB and on all IGBs across Scotland remains highly uncertain. We've continued to regularly update our estimates, including the financial implications of our initial mobilisation plans. The COVID report provided by the Chief Officer today sets out a revised forecast of 9.4 million, which is the latest position that we've submitted to the Scottish Government. However, this doesn't yet take into account the Q1 detailed financial review, which we're currently undertaking. And this review will look at underspends within our financial position that are a direct result of the COVID position, and that should legitimately therefore be set against forecast COVID costs. Formal submission of a Q1 forecast is due into the Scottish Government on the 14th of August. The Scottish Government have indicated that following the Q1 review, additional budget allocations will be issued by them by the end of September. Today, 1.4 million.
Sorry, Jane, we've lost you there. Sorry, Jane, we've lost your signal, but we're not hearing you just now. Could you possibly consider putting your camera off? We might be able to hear you better. Sorry, we just can't hear you at the moment. Again, can I come to Audrey and ask if there's anything we can do to assist with Jane at the moment? Jane has obviously left the meeting now and is going to dial back in. Bear with me a moment. Okay, so we're trying to we're obviously hoping anybody with connection difficulties during the course of the meeting, if they can first of all try leaving the meeting and immediately rejoining, or alternatively using the telephone option as a last resort. Okay, Jane, are you with us again? No, you're not. Okay. In that case, we'll just have to park that item on the agenda for the time being, and we'll restart that. Hopefully, if we can get Jane back during the course of the next item. And so, if I can possibly move on to item 6 on the agenda and ask Gordon Patterson to give his report on the Partnership's COVID-19 pandemic response and the remobilisation of services. Thank you, Gordon.
Thank you, Eric, and apologies to members for these technical difficulties. Hopefully Jane will join us again shortly, and if not, I can perhaps pick up some of any queries around the current financial position as we understand it in the context of COVID-19. And this report, item 6, is effectively my update report to the IJB with details of the Health and Social Care Partnership's remobilisation plans and activities in response to COVID-19. It builds on the report that I gave to the May IJB and to the June Audit and Performance Committee. It's perhaps fair to say that the report includes more operational detail than the IJB would ordinarily consider. However, the exceptional and challenging circumstances that we're in, I think, heightens the need for us to ensure that the IJB is well informed on the work that is being progressed, and that the Health and Social Care Partnership is able to account and provide assurance to the IJB in response to how we are remobilising services in the context of COVID-19. The references that the Chair made earlier to our ambition that we will potentially be in a better position if the current disease progression is able to be maintained and the low incidence, infectivity and prevalence rates can be achieved, would be the ambition that we would all hold. However, I think we're also all collectively keeping a watching brief on developments elsewhere, and we can see that, for example, in England, in the last 24 hours, there has been a reintroduction of lockdown in parts of Lancashire, Yorkshire, in addition to those others. So we need to be very cautious about this, and I think it's also important that my report ensures that members are appraised of the challenges that we're continuing to face. I certainly don't want us to be developing any notion that we are post-COVID and returning to normal. I think also the level of detail in this report is perhaps hopefully helpful to remind members or introduce new members to the scale and breadth of the Health and Social Care Partnerships business, delivered by over 2,000 council and NHS Tayside staff, to the tune of a value of around £200 million. So the report does include information therefore then about the hosted services that we have a responsibility for. I've sought to include in the report, and I would particularly reference section 2.3, the way in which we as a Health and Social Care Partnership have an ambition, and there's that ambition word again, to capitalise on some of the positives that have come out of our experience over the last 4 or 5 months. So out of the most challenging circumstances, there are things that we have done well, there are barriers that we have overcome, there are challenges that we have been trying to address for some time that we've been able to address in the context of the response to COVID-19. So hopefully we can capitalise on those positives and at the same time address some of the shortcomings that had previously been identified in relation to the Health and Social Care Partnership's performance over the last couple of years in either audit or inspection reports, in order that we can build a better Health and Social Care Partnership and achieve improvements. So turning to the report in a bit more detail, and I don't intend to go through it section by section. The report starts off by providing some benchmarking data from National Records Scotland publications, which may provide some context and useful information for IJB members. It then, in its most detailed section, talks about how we're remobilising in hospital services, community services, social care, primary care, and in hosted services. I would highlight to IJB members that we've given substantive detail in relation to 2 areas, which are areas that warrant that attention, that are important, and that continue to attract heightened attention locally and nationally. And those are the sections on support to care homes, where we have a detailed appendix that includes how we are maintaining clinical oversight and support to the care home sector. And I have at the IJB today, we have Caroline Wilson and Sandra Gourley, who've been leading on that work and may be in a position to answer any perhaps of the more difficult questions that members may have around those items. The other item that we've given significant attention to is obviously mental health services, and that reflects the commitment that we've got to looking at how we can enhance community mental health support to people anyway, but particularly to people who may now be struggling with mental health issues as a consequence of the impact of COVID-19. And I think I'm seeing, and others are perhaps seeing, a growing awareness of the potential longer term impact of COVID-19 on the emotional health and well-being of our citizens and the resilience of our communities. So we need to give that significant focus and attention, and I hope the information in the report assures the IJB of our commitment to do so. I would otherwise not propose to go through the report in detail, anticipating that members have had the opportunity to read it. However, myself and colleagues, Jane Smith, if she's managed to return, Evelyn Devine, the Head of Health, Hamish Dougal, who I think was also struggling to gain access as our Associate Medical Director, and as I mentioned, Sandra and Caroline would be available to answer any questions on this report. My final comment would be to say, and I think I've said this before, that this is quite a dynamic process. We are developing new approaches as we go, and we are about to submit, I have to say, the next iteration of our mobilisation plan. So this is quite an iterative process which we've produced in consultation across the partnership and with the other partnerships and with NHS Tayside, to put in a robust joint mobilisation plan that the Scottish Government have requested of us by close of play today. Chair, I'll pause there because I know that members will have had the opportunity to read the report, hopefully with interest, and no doubt we'll have some questions about it.
Thank you, Gordon. Much appreciated. I'm delighted to say that I believe we now have Grant Archibald, the Chief Executive of NHS Tayside, has joined us on the telephone. Grant, good morning to you, and I hope you can hear us.
I can, Eric, and if we could just make sure it's recorded. I've been on the screen since 10 to 9 this morning following the instructions I was given. Had a blank screen and tried to contact people prior to 9:30. I've been watching everything, but obviously there's some areas have been commented on by others that you might have wanted me to comment on. Unfortunately, I could hear you, but you chaps couldn't hear me. So I'm now doing that thing of watching you on the screen, but joining you by telephone. So I am here and have been since the start of the meeting.
Okay, thank you very much, Grant. Was there anything, if I may just pause Gordon, with your report and just ask if you had anything specific that you wanted to come in with about what we've already discussed, Grant?
Just to say that I'm fully supportive of some of the issues that have been raised by Councillor McDade and others, and I hear his enthusiasm that we, in addition to describing things, get things done, and I agree with that. These have been difficult times, but we need to understand that in addition to responding to COVID, which Gordon has very ably described, he, I, Karen and others are all working together to make sure we progress other matters that are very important to the IGB, the people of Perth and Kinross and our employees. So fully supportive of all of that has been said already, and we are playing our full part in that.
Thank you. Thanks very much. Okay, so returning to where we are here, I'm delighted to see that we have also now been joined firstly by Dr. Hamish Dougal and also in the last few seconds by Jane Smith, our Chief Financial Officer. So thank you to both for rejoining, and I hope the connection stays and that you can stay with us. Now, reverting to Gordon's report, can I ask anyone who has a question? There is one there already, but if anybody else has a question, if they can type Q in the message function. But before I come to any questions on the chat function, given that we have a number of people now on the telephone, I will give an opportunity to these people to pitch in first. So first, I'll just go around those members that I understand are on the telephone, and if there's somebody else that I haven't listed here, if they can shout out once I've got through the names I do have. So firstly, can I ask Patrick if she has any questions at this point? We may have lost Pat, unfortunately. Can I ask Maureen? Maureen, do you have any questions at this point?
Can you hear me?
Yes, I can hear you, Maureen.
Because I've lost everything off the screen and Raymond's on his way to try and help me. I don't know what happened, but a message flashed up and then I lost everything. So, but anyway, as long as you can hear me, the question was that it was mentioned at a previous meeting that a lot of carers who had, taken people that they were caring for out of care homes were actually being encouraged to, look at that again and to accept extra support. But I don't know whether that's actually happened, and I know that there's a lot of carers out there that are actually struggling, not necessarily because they've taken somebody out of a care home, but because the caring role has increased and they're probably struggling. I wondered what kind of outreach has been made to these people.
Thank you. Gordon.
Thanks, Chair. Maureen, thank you for your question. I don't think it's the case that there have been people taken from care homes, certainly to any great degree. Certainly in the past, we've highlighted the fact that when lockdown was introduced, a number of families themselves decided that they would provide and be able to provide an enhanced level of care to their usually elderly relatives, rather than those people need to rely on our care at home services that we either provide ourselves or we commission from the third sector, from the independent sector. So we did see a reduction in the demand for our services in March, April and into May, particularly because family members were available to support their loved ones. But also, I think it's probably reasonable to say there was probably a heightened anxiety about people not wishing necessarily for care staff to come into the house if that could be avoided. I think from the outset we had anticipated perhaps, and it's been proven to be wrong, that we would maybe only be dealing with COVID for 2 or 3 months, and we now know that we're involved in a marathon rather than a sprint, if I could describe it that way. So what that's meant is that many carers, family carers, have come to recognise that they can't sustain the level of commitment that they'd given from the outset. So what we've been doing is getting alongside those carers and having discussions with them about reinstating care packages, about enhancing the level of care at home support, about the role of the third and independent sector in providing support, and recognising that there are some services that we're still unable to provide to the same degree. Things like daycare, where people would naturally have to come together. We're looking at a different approach to the provision of daycare. Things like respite care, which is a valuable and important service. We're having to look again at the opportunities that are available to us to deliver that overnight model of care to relieve carers of some of the challenge. So I would certainly wish to assure the IGB and yourself, Maureen, that we are acutely aware of the contribution both of unpaid carers and of the third sector, and are engaging with both in order to ensure that people are not feeling that they're isolated, they've been left on their own, and we are reinstating and increasing the support that we are now able to offer. So that's helpful.
Okay, thank you.
Thank you, Maureen. Now, just to those on the phone and Pat in particular, if in order to unmute your telephone, if you're having a difficulty with that, can you press the star sign and then the number 6 to unmute yourself? I'll give you a few seconds to try and do that. No. Okay, we move on. Councillor Duff, you have a question, re cancer services.
Thank you, Chair. It just seems to be taking a little minute to unmute. Yes, just first of all, we acknowledge the comments in 2.3 of the report, and I think we note how well and how willingly staff adapted to working under the COVID-19, and it's good that we note the positives and look to make these part of future services. My comment in regard to remobilisation is I'm aware from the media that obviously certain services have had to be truncated during the last 4 months of COVID-19, and I just wondered if we could update on where we are in relation to the diagnosis and treatment of cancer conditions.
Gordon?
need to unmute Gordon.
Sorry, Councillor Duff. Thank you. Happy to try to respond to that, but I need to qualify it by obviously pointing out that the provision of those types of services fall to the acute division and NHS Tayside rather than necessarily to ourselves, although the Health and Social Care Partnership will be involved in supporting people through the third sector and in terms of any support they need in their own homes. I recognise the question. I think it's a reflection on what is a growing debate nationally about the extent to which the NHS generally is now better able to remobilise, because the demands from COVID-19 in terms of hospital admissions, in terms of ICU, thankfully and positively, have not perhaps been as great as we'd hoped for, and we hope that continues, and have declined through the months of late June into July, up to the point where we're at now. Against that backdrop, recognising that early on NHS Scotland had taken the view that some treatments and support to particular conditions could be scaled back and needed to be scaled back, because the NHS in Scotland was, as we know, planning for the worst case scenario and was seeking to ensure that that capacity was there should COVID demand it of us. NHS now has moved to a position where these sorts of services are remobilising. I think we've probably heard mention of this in the First Minister's briefing. There has certainly been guidance issued to the NHS from the Scottish Government about the need to prioritise some of this. Cancer is at the forefront of that. NHS Tayside had been performing at an exemplary level pre-COVID in relation to performance in respect of cancer, in terms of screening, treatment, waiting times, and now we'll be moving back to a position where that is prioritised. I don't know from a clinical perspective whether it would be fair to bring in Hamish Dougal here, and this may indeed be something that Grant Archibald would wish to comment on. The only thing that I would add to that is I'm aware that staff working in oncology and in cancer treatment and diagnosis were amongst the first staff that the Scottish Government required to be proactively tested for COVID in relation to ensuring that when those services came back on stream, there wasn't a risk or there was a minimisation of the risk of infection. So I wouldn't probably be able to say much more. I'm keen that if others feel able to, they maybe contribute at this point.
Yeah, Grant, I think Grant Archibald, I think you've indicated a desire to comment at this point.
Yes, please, Chair. Although I must say that Gordon's done an excellent job in his answer. Perhaps 2 or 3 points in respect of the councillor's question. In terms of acute services, what we did inside Tayside was divide our efforts into 2 areas, and these were the response to COVID-19, but also what I termed service critical, because during the period, ladies were always going to be giving birth, people were going to be attending A&E departments, there might be car crashes, there would be heart attacks, and importantly, there would be the ongoing progression of people's cancer disease. And therefore, we prioritise all those factors in a parallel stream of work inside the hospital, and sought to maximise our efforts around those, while stepping down far more routine issues. Perhaps I could give the example of hips and knees, although obviously those are important to people. Cancer is absolutely a priority. One of the things we've been very keen to notice across the whole of Scotland is the referral rate in for cancer presentations pan-Scotland has dropped to 75% of what we would normally expect. So we do have a challenge about reaching out to people to make sure that they are approaching their GPs and indeed hospitals, because that is not a morbidity change, that is a change in behaviour. We need to reach out to people, and that's why we try to stress what services were still absolutely open. Going forward, there is a challenge, and the councillor mentioned diagnostics, and that's a key part of the journey in terms of cancer. And one of the issues we have with COVID-19 is the production of droplets at any time in any process is a danger. And in recommissioning and remobilising our services, as Gordon has and we're describing in an overarching paper for the whole of Tayside, there is a double safe rule, which is safe for the patients, but also safe for the staff. And the reason I reference that is endoscopy is identified as a riskier procedure. Now, what we've done in the early stages of COVID, we'd continued to concentrate scoping in a safe environment on the Perth Royal Infirmary site to try to make sure we dealt with cancer and other presentations. What we are doing now, Councillor, is looking at different ways of working that would allow us to continue to move forward. I had a meeting this week with Cancer Lead for Scotland regarding an early diagnostic service. We're getting more MRI and CT scanning provision as well. But in terms of scoping, we're doing something really radical, which is anybody who's had a scope before knows it can be quite an unpleasant experience with a large tube being passed into your body. What we're developing is a trial of what's called a pill camera, which means one swallows a pill, maybe about the size of an old-fashioned jelly baby, and have 8 or 9 sensors connected to your torso, and the pill follows its way through your body and comes out the other end, obviously. But the important thing is it relays images to these sensors around your torso, and they will allow us to do a virtual endoscopy in a different way. Now, this is very radical and new, but I'm very pleased to say Tayside is in the vanguard of this. We are 200 cases away to start. We hope we might be able to do 800. And the reason for articulating that, Chair, to the Councillor is to say that in the post-COVID environment, we do need to find different ways of working, and the point is incredibly well made. While we do need to respond to the emergency requirements of COVID patients, we also need to remember the needs of those with chronic and severe conditions, cancers and others. And I would like to assure the Councillor that those are very much at the heart of our plan. We are remobilising, but we have to do it in that double safe way of it's definitely safe for the patients and it's definitely safe for the staff. I hope that's helpful, Chair.
It is indeed. Thank you very much for that, Grant. Gordon, you mentioned in your comments that Hamish Dougal may wish to comment. Hamish, I don't know if you do, if you've got anything further to add.
Yeah, I think I'll perhaps just add a couple of things, probably just to reiterate and reinforce what both Grant and Gordon have mentioned. I think the COVID has seen, and I'm delighted Grant's picked up the example of endoscopies, because I think we've seen a substantial push forward in changes of doing things differently that I think will be beneficial to the system going forward, and I think people have been looking innovatively at how they can provide the services at this current time. Secondly, it's very clear that there's been a very strong message from NHS Tayside all the way through that the services are open and the urgent referrals are being dealt with in a timely manner going through. There was an issue at one point of a bit of a backlog of radiologies, you can imagine, at the very outset of this, but NHS Tayside worked very closely with primary care to do a thorough check on everybody on the waiting list for reprioritisation going forward, and that was completed within about 6 to 7 weeks of the start of the COVID, which I think was an exemplary provision. I think the other thing to remember when we talk about cancer care services, it's not just about diagnosis, it's about treatment. And clearly the risk and benefits of treatments need to be weighed up as we go along. And in the COVID environment, patients who are immunosuppressed are very susceptible to COVID infection. And there's been a very good collaborative right across Scotland in terms of what is safe and what it's like to be effective for patients in this. So I think really just to add on to what Gordon and Grant have already said, I think there's been a great deal of work going forward. And I'm delighted to see that we're looking at different ways of working to provide the best services for our patients.
Thank you, Hamish. And Councillor Duff, I hope you'll agree that you've had 3 answers to your 1 question.
Yes, very full, very helpful. Thanks very much for all 3 gentlemen's responses. Thank you.
Thank you. Okay, next question is Councillor Purvis, please.
Thank you, Chair. And I was just going to make an observation about my disappointment of the imposition of the same rule from the Council in relation to questions. So I think it's interesting to note that we're allowed 3 answers to a question, but we aren't allowed to ask more than 1 question. Anyway, I shall begin with my first question, and you can decide whether to allow me any more. The first one is in relation to governance arrangements, and I know that we'll be discussing that later on, but specifically we've made a number of improvements in relation to delayed discharge and the responsiveness of services and the use of digital, which is referenced in 2.3 on page 8 of the report. Obviously, as the Chief Officer will be aware, that the Council are looking at similar things as part of the Perth and Kinross offer and trying to implement a think yes attitude to solving problems. Now, I know that a number of the improvements that have been made are perhaps not sustainable given the redeployment of staff, but I think there are many lessons that we can learn. I'm just wondering how you think that we can embed this into the IGB's decision making, noting the report later on the governance structures. Although it talks about meetings and committees and things like that, it doesn't actually talk about how, if we're going to move to a more responsive and adaptable delivery of services, how we ensure that we can be satisfied that the strategic direction that the IGB is setting is being implemented, because with these changes to the way that the services are delivered, we also need to change the governance arrangements with that. Obviously, we can come back to that later on, but I would just like to know what the Chief Officer's thoughts are on that.
Thank you, Councillor Purvis. I think that's quite a challenging question, and my reason for saying so is because I haven't had a great deal of time to reflect on that interplay. But I think a couple of things I would reflect is that absolutely we have been driven by operational imperatives. We've been reacting, and we've been responding. I would hold out more optimism than perhaps articulated in your question about the sustainability of those improvements, because what we've had is the confidence and the need to test new things. We've worked across organisational boundaries, we've redeployed staff, we've put resources in where we've identified it's needed. And our mobilisation plan is really about how can we sustain that whilst trying to bring other services back on stream. And bringing services back on stream is not about reverting to how they used to be delivered. It's about how they're going to be delivered for the course of this year in a new way, with the restrictions around physical distancing, around PPE, around spaces in wards, etc. So I fully appreciate that what we've been embarking on over the period of time that we're describing has been operational, it's been reactive, but it has delivered and I think can sustain some of the improvements. What it hasn't allowed us to do is have the time necessarily to step back and say, what is our strategic direction in relation to different client groups or care groups? What is our progress in relation to the transformation plan that we outlined at the start of the year and the improvements that we sought to deliver? It has been very much about the operational and the reactive. So what we need to do is to find a way to continue to sustain and respond with pace, with fleetness of foot, when different things emerge, whilst trying to take that much more strategic view and trying to support the IGB to be able to apply that scrutiny and seek assurance in relation to the direction in which we would wish to travel. Now, Bob Benson asked at the last IGB whether our experience of COVID-19 was changing our strategic priorities. It isn't, I don't think, changing our strategic priorities. We still want to support early intervention and prevention. We want to strengthen communities. We want to address health inequalities. We want to support the delivery of person-centred care, and we want to achieve best value. What it has changed is the way in which we're having to get there. And we need to hold on to those strategic priorities as the destination, not that we will ever reach them. So I think we need to find a way of creating a little bit of space and time and capacity to reflect on how we do sustain those improvements and how we do ensure that we can provide the opportunity for the IGB to have more of a strategic than an operational oversight. And I have acknowledged this report is very operationally focused. The other thing that I would suggest, though, might confound some of that, as well as the threat of a second surge, is that at this time of any year, we would be beginning to think about winter planning. So there's a lot of work being done offline that we will appraise the IGB of in September in relation to our preparedness for the winter, which is about ensuring that there's capacity, ensure that there's patient flow. But we've got that overlaid with the additional challenge of COVID. We've got a very ambitious vaccination programme that we need to deliver. And we have to recognise that people, as we move into winter, may well have the symptoms of colds and flus and may well fear that that's the symptoms of COVID. So larger numbers of people who aren't perhaps testing positive may well have to self-isolate. And by that time, we may have a different operating environment that will challenge us. I think I'll pause there. I recognise your question. I fully appreciate the need to attend to those issues, and I would certainly also welcome contributions from others who are on the call and feedback from the IGB members themselves about what you would wish from us in this regard, in order that we can ensure that you're equipped to carry out your task moving forward.
Okay, we'll thank you for that, Gordon. We'll come to comments from others at the end of questions. There aren't currently any other questions, Councillor Purvis, so go with it.
I think Sandra Oldknow got a question.
Beg your pardon? Sorry, Gordon.
Sorry, I thought I saw that Sandra Old maybe had a question. I could be wrong.
Comment, Sandra's.
Yeah,
my apologies.
I've got a comment.
Yeah, we'll come back to you, Sandra, with regard to a comment, if you don't mind, after the questions. Okay, so Councillor Purvis, do you have a further question?
And just on that, Chief Officer, thank you for your response. I think I agree with you. It's not about changing the strategic direction, and I agree that we should continue to look to get as far as we can towards that. It's about, and we can pick this up later on in the paper at the end, it's about how we, if we're changing the way those services are delivered and the governance arrangements operationally, then I think that changes the way that we seek assurance that those strategic directions are being met. But I'll move on to the next question. The next question is on social care, so care at home and care homes. I know that we have had updates from you, those of us who are councillors, and I presume you've been providing similar updates to the NHS Chief Officer on testing in care homes and routine testing in care homes. And I know that you have started to do sampling of care at home staff as well in terms of testing. I'm just wondering, you talk in your report on page 12 about supporting the delivery of care at home services with a bank of staff who can be redeployed. I'm just wondering if you could maybe give an update on testing in relation to those services at the moment, and what the plan is to continue that going forward. Obviously, we want to ensure that those we're providing care to are not exposed to the coronavirus, and indeed other staff who are delivering these services as well.
Okay, thank you for that question. I think the situation with regard to care homes is that it remains a very high focus of our attention. We have, I mean, I think my report and the supplementary appendices give a lot of detail about the enormous amount of work that's going on with care homes. So I don't want to revisit all of that. In relation to testing, what I would say is that we have moved to a position where over the last few weeks we have achieved consistently, I think over the last 3 weeks, a very high return in relation to those care homes who are availing themselves of the weekly testing arrangements that have been put in place. This has been a priority of the Scottish Government, and we have been asked to facilitate and support it. We have to recognise that the care homes are in Perth and Kinross. There are 38 independently provided care homes and 2 that are provided by the Health and Social Care Partnership or Council. Fair to say from the outset, I was a bit unsure about the extent to which care home providers would see the need to have testing done every week. and in the early weeks that was presenting a bit of a challenge. Some of it was about accessing the system, some of it was about accessing the testing and delivering the testing, and some of it was about telling us that tests had happened and reporting. I am pleased to say that we have moved to a very different position in the past month. We're now at a position where 60, 70, 80% of all staff in care homes in Perth and Kinross are being tested each week, with high numbers, the majority are returning negative tests, and when positive tests are returned, we are quickly retesting because we're aware that there is a risk of some false positives, and that can have a significant impact on care homes. Certainly where there are positives, that also has a significant impact, because what has been introduced in recent weeks is the opportunity for increased visiting to care homes, but that can only be done if care homes are COVID-free. If there are positive tests, then care homes have to wait 28 days before people can visit. I think in the context of what we've described elsewhere, the potential of a second surge, the developments that we're seeing in England and Wales, the potential also of challenges coming through the winter period where more people might be unwell with different things. We can confidently expect that care homes will continue to be the focus of our attention, and that attention is probably really important, I acknowledge, and apologies for not doing so until this point. That attention is a collective endeavour. The Scottish Government has charged the NHS and provided guidance and support to Directors of Public Health to ensure that they are front and centre of all this, and about 6 weeks ago also required the Director of Nursing and NHS boards to take clinical oversight of what was going on in care homes. So the approach that I've described in my report that we're taking locally involves colleagues from within the Health and Social Care Partnership, from social work, social care, nursing, visiting care homes, monitoring care homes, providing support, providing advice, providing infection prevention and control information, supplying PPE where that's necessary. And we do have a bank of staff who could be redeployed if needed. And the NHS in Tayside and nationally has opened up the opportunity for its bank staff to potentially be brought in to work in care homes if colleagues were minded to volunteer to do so. I'm very pleased to say that we haven't had to call on that the ways in which we've managed the level of infectivity in care homes, which is in no measure down to the effectiveness of those providers, and the joint working approach that we've taken, has meant that we haven't had significant pressures, or they haven't experienced significant pressures in relation to levels of staffing. Now, it would also be remiss of me to not acknowledge the fact that Lynn Blair is a member of the IJB. She is the integration lead for Scottish Care locally, and has been working very closely with us. And it's actually to Lynn's credit that much of this has happened because of her work with the sector, the care home sector in Perth and Kinross. So colleagues may wish to come in. I know that Sandra and Caroline are available to answer any specific questions. And as I say, Lynn might have something that she would wish to add, but I don't want to put pressure on anyone to speak.
Lynn, you've just beaten me to it with putting a comment there, and thank you for that. I was just going to come to you and ask you if you wanted to add anything at this point.
Yes, just on testing, I'd just like to say I think this week it's looking like 86% of the staff in the Perth and Kinross care homes will be tested. That's certainly sort of going up, and we have quite a lot of staff that do even come in their days off to be tested. So I think that's to their credit, that they're wanting to make sure that they're as safe as they can be for the people they look after. The one thing just on testing that I'd like to highlight is really the amount of time that takes for care homes, and I think that can't be underestimated. There is a portal that isn't that user friendly, and for each member of staff it takes about 20 minutes to input that. We have some care homes that have 97 staff, so that takes one member of staff the whole week to do that. So just to bear that in mind with testing. But I do think the joint approach we've had has made a huge difference, and the care homes have been very, very aware that they've had really good support from the partnership, and we've had Zoom calls, and they really appreciate all the senior staff that have made time to come to those Zoom calls and answer their questions. So just to say that the care homes do really appreciate the support that the Health and Social Care Partnership have given them.
That's very good to hear, and I was going to ask you that question myself, Lynn. So thank you for that. I appreciate we're merging, despite my best endeavours, merging comments with questions. But I think it's appropriate that we give full attention to this obviously very sensitive matter, especially following the BBC Disclosure and Panorama programmes, which have highlighted issues across the United Kingdom. Jackie Pepper, I think you're looking to make a comment on this as well at this time.
Thank you, Councillor Dysdale. I'm really pleased to hear Lynn and her comments there, because I think it's been really important to have a support role for care homes and throughout this crisis that we're experiencing. It would have been very easy to move into more of a scrutiny role, and really I think the staff within the Health and Social Care Partnership and my engagement with them throughout this whole period to ensure that care homes are supported and that that's a positive experience for them. I think they should be commended for taking that approach. Thanks.
Thank you. Thank you for that. And Councillor Purvis, I hope again you're satisfied with that.
No, thank you very much. That's very reassuring, and that's certainly a marked improvement we've seen over the period of time. And I appreciate that it is a burden on the care homes to have to go through that, and their staff to take time out of their day to do that. But obviously, it is ensuring that we protect both the people who are in care homes and those using care at home services, but also the staff as well, interacting with others. So that's very encouraging. I have one final. I'll restrict it. I had more, but I'll restrict it to one final one, if that's okay.
Sorry, again, if you wouldn't mind, I will come back to you, but I believe we have Sandy Watts, Third Sector Forum stakeholder member, on the phone. So just in case we lose you, Sandy, again, I believe you have a question. You need to, if you're on mute, you need to press *6.
Hi, sorry, it took a moment to unmute me. Is that okay now?
Yeah, that's fine. I can hear you fine.
I think I'm actually out of sync with where we are in the discussion, and I do apologise because I've been having technical difficulties and running between the phone and the computer. It was actually a question about support for the third sector, which I'm not sure we've quite got to yet.
Not really, no.
So do you want me to hang on and come back later?
But is your question to Gordon Patterson? Sandy, is your question?
It will be for Gordon, yes.
Okay, let's just go with it. Thank you.
You want me to go with it?
Yeah, just ask away.
Sorry about this. It was in the paper, it refers to support for the third sector, which is brilliant. We were just seeking some clarification, if we could. Most of the third sector organisations have worked throughout the lockdown and are reporting increased demand. So any support would be very gratefully received. We're just seeking clarification as to what that support might actually look like. For example, things like PPE, which some organisations are struggling to access, and it's costing more because obviously we don't have the benefit of bulk purchasing. So if we could have clarification on what support may be available in the future, that would be great. Thank you.
Gordon?
Yeah, certainly, Sandy. We need to address this. I think this is a really important issue. It's one that I've raised with colleagues in the course of this week, because we do have some provision in our budget as a projection for what's described as payments to third-party suppliers, and we have a process for supporting that. and for applications to come in and to be considered, criteria that we have that enables us to provide such payments. And I think my report gives an indication of the level of payments we've made to date, although we do expect there to be many, many more. Now, I have to say that the focus of that has really been around the care at home and the care home services. So before I came on the meeting, I had an email from Zoe Robertson, who leads in our commissioning and contracting team within the partnership, and a discussion around whether we can extend that to other services who we commission. Now, my ambition there would be around, I suppose, 2 or 3 things. One of them would be around what falls within the criteria that we have in relation to where payments can be made. And that might be around PPE, that might be around new ways of working, that might be around mobile technology, that may be around additional costs that have been incurred because of staff sickness or staff support. So that would be one area. But the other area, and it's the area where I have highlighted in my section on mental health, I would like to see some additional consideration being given. And that is thinking not just about how existing services are remobilising and recovering, but how much reach do those services have into parts of Perth and Kinross that are maybe access deprived and rural. So the question that I'm putting to my colleagues, which is a question that would require us, and hopefully you would welcome the engagement with the third sector, is what might we now do to ensure that services are reaching people who might not previously have been affected by, or who might not previously have needed support, but might need it now because of the impact of COVID. And that might be around carer support, it might be around emotional health and well-being, it might be around more acute mental health services. So what people might we reach out to, and which parts of Perth and Kinross do we not currently service to the extent that we should? And is there something there that we can put into our mobilisation plan? And is there a potential for us to have some additional investment in order to ensure that we're getting in early and we're preventing more acute episodes from arising? In that context, I have to say that we did put a call out for additional proposals from providers who support people with mental health issues, emotional health and well-being. And yesterday I got a report to say that we'd received 9 bids from 9 different organisations. And looking at them, as I did last night and as Zoe Robertson did, we think that we can support those, and we will go forward and have further discussions with those providers about enabling them to deliver different services in different ways to different parts of Perth and Kinross. So I think we'll continue this conversation offline with an assurance that we're looking at how we can support the third sector to support us, to support the people of Perth and Kinross.
Thank you, Gordon. Thank you for that answer, and I hope that's okay with yourself, Sandy.
Yes, thank you very much. That's really encouraging. That's brilliant. Continue it offline.
Okay, thank you for that feedback. If I may, just before I return to Councillor Purvis for his third and final question, can I just revert to the previous discussion that we were having around care homes, etc. And I note that Sandra Gourlay, lead nurse, has posted a comment in the meeting chat. Sandra, I wonder, just so that this is into the public domain, I wondered if you would come on just now and just repeat what you said in the meeting chat.
Yeah, happy to do that, thank you. Yes, what the comment I put on was that I would just agree with Jackie Pepper's comment that the approach that was taken with the care homes when working with them has been consciously supportive in nature, and it's demonstrated a really positive example, I believe, of integrated working across health, social care, public health and health protection teams, Scottish Care and the Care Inspectorate. And it's certainly been something, it has been a lot of work to do the visits and to support the care homes, but I think predominantly there has been examples of significant good practice that's been demonstrated through the visits that we've undertaken.
Thank you, Sandra. Thank you for that. And if I may just say that I am absolutely delighted, as I'm sure many people will have done, will have watched the disclosure and panorama programs this week on this area. And panorama last night was very emotional. However, what I'm hearing here from multiple sources is how well the Health and Social Care Partnership and NHS Tayside and Perth and Kinross Council have collaborated with other stakeholders, all the various stakeholders, and are tackling this possibly the most difficult issue associated with the pandemic in an excellent manner. So thank you to all involved, and I think Gordon, you want to come in and add something as well.
Certainly, I would echo your thanks, and would wish to convey mine for all that people have done in a very challenging environment, and with a degree of well, a high degree of adaptability, versatility, and the professionalism and compassion that we've come to expect from colleagues. However, my point was really just picking up on the fact that you've identified that Sandra put something in the chat that isn't available to the public, and you asked her to come in. So I would wish to just acknowledge that I've also put in the chat, and would wish to publicly acknowledge the contribution of Jackie Pepper as the Chief Social Work Officer from Perth and Kinross Council, and her active, positive involvement in the support that we are providing to care homes. The challenge and advice that she's given us has been really helpful and really welcome, and Jackie is very much part of that collaboration. Thank you.
Thank you. Okay, I'm conscious of time. We have one final question from Councillor Purvis, and at the moment we have another comment to come from Sandra Auld after Councillor Purvis. So, Councillor Purvis.
Can I come in after Councillor Purvis, Eric? Can you hear me?
Oh, Pat, you're there. Yeah, absolutely.
Yes. Here all the time, but just a very brief question, but after Councillor, I'm happy with that.
Okay, thank you.
Thank you, Chair. I think most of my question has actually been answered by the previous question that Sandy Watts asked. It was specifically on the mental health part of the report, and I think it's very welcome, the suggestion of a mental health hub. I was just wondering, is the suggestion that will be a physical hub? And then my second point was just going to be, which you've already covered, Chief Officer, about ensuring that while technology is great, it's not just a case of those who can't use technology, and particularly when it comes to mental health, that actually face-to-face conversations, I think we would all agree, can be needed in any case, even if someone is able to use technology. So just wondering if all of those things will be taken into account, and specifically on the hub. Thanks.
It may be that Mr. Patterson would have been covering that in the item on mental health services later in the agenda. However, Gordon, do you want to make a brief comment just now?
Yes, so my later report about mental health includes a very short paragraph around our response to COVID, and it refers back to the more detailed information that I've got in my COVID report. So happy to take it in either regard. And I might ask Evelyn Devine to come in relation to the question about the hub, which yes, we would look to have as a physical hub, as really a hub where there was activity, where there was services, where there were opportunities for people to connect. But I'll bring Evelyn in a minute, but I think it's really important to acknowledge Councillor Purvis's question and the insight that he has demonstrated, the reminder he's given us about how challenging it can be to be working in a remote world, and I think we've experienced some of those challenges today, but challenging also in relation to connectedness, into meaningful contact with people, to be able to have relationships, to be able to check in, and I think that there's a growing recognition that COVID and lockdown and the social restriction measures will be having an impact on many more people than who might otherwise have had difficulties with their emotional well-being and resilience. So we need to get beyond the bit about virtual contact and face masks and where opportunities arise, recognising that we still want to keep people safe, and that's staff and that's people who access services, to have that personal contact, to be in touch with people, and to not make assumptions that everyone has embraced the digital world and everyone has information technology and opportunities to use the internet. So we will continue to be reminded of that and continue to look at how we can address that and find ways of delivering services that ensure that we maintain that personal contact. And that's particularly important in mental health services. It has also been important in our drug and alcohol services, and clearly it is of significance and importance in relation to adult protection services. So there are still some services where we're visiting, where we're making personal contact. We hope to be able to do more of that in the context, obviously, of keeping people safe. Evelyn, would you like to come in if you're available to say a little bit more about the plans for the hub?
Yeah. So I think in respect of the David Strang report and our recent HIS inspection, there's certainly an appetite and a need for us to look at equity in terms of provision around crisis response and urgent response to people with mental health conditions. So we would like to go out and work with our stakeholders in relation to a very focused piece of work around a mental health one-stop shop. So that would be offering advice and access to therapeutic interventions, and running that basically in relation to collaboration with the third sector and the voluntary sector. The hub would support recovery, accessible community-based interventions. It could provide CBT in terms of support there, and really just offering other opportunities for people. We would be wanting to support that with advanced nurse practitioners who have mental health advanced experience in supporting people at that early stage, but also looking at, we're working with Tayside at the minute around distress brief interventions. It is a national programme in relation to how we support people at that early stage in relation to anxiety and support there. So again, a lot of these elements would be available through the mental health hub, supported and maybe led by the voluntary sector.
Thank you, Gordon. Thank you, Evelyn, and I hope that's again a comprehensive answer for you, Councillor Purvis. And I think we have a further question from Pat Kilpatrick.
Thank you, Chair. It's just a very brief question. I read with interest the inspection report by the Care Inspectorate for the Glen Helen Bank residential care home, and in the evaluations, out of the 4 criteria that they mention, 2 are rated as weak: care and support and infection control, and health and wellbeing, support and safeguarding, and staffing arrangements are just listed as adequate. And I saw that there was some press coverage of this as well, and I'm just wondering, I know Gordon's talked about providing additional support to homes and a lot of work going on there. I'm just wondering if we as an IJB can be assured that the standards in that home have significantly improved or are in the process of improving.
So I would certainly assure the IJB that we, with partners, are looking very closely at how that care home and others are delivering care at an appropriate standard and addressing any shortcomings, either identified through the Care Inspectorate or through our own visits, because we've visited 38 out of 40 of the care homes in the last month. And we're working with the sector. We're trying to take that improvement focus. We're trying to be supportive, and we're working with the Care Inspectorate. And it was encouraging that the clinical oversight group that's chaired by the Director of Nursing this week had a representative from the Care Inspectorate in attendance, and we were able to ensure that she was appraised of the work that we are doing locally and vice versa. I would be keen, because I see that she's made a comment, to perhaps bring in Caroline Wilson, who will be much closer to this, given that Caroline has led on the visits to our care homes and would be in a position to be able to provide some degree of assurance. So if you'll allow me, Caroline, could you come in?
Thank you very much, Gordon. Can you hear me okay?
We can hear you, yeah.
So the visits obviously were a very supportive nature. They were done by the Health and Social Care Partnership, and they covered the areas that has been identified by the question. Just to say that I can give full assurance that all work is going on with the care homes from the partnership in supporting them to make sure that they can provide the care assurance to NHS Tayside, which is required, and that when additional support is required, so for example, infection prevention control nurses are involved in care homes that are needing additional support, the advanced nurse practitioners are involved, the nurses involved, we've put in that level of support so that the care homes have got that support and we can provide that assurance. So hopefully that will answer your question there in terms of the situation that you've raised, and that yes, the support is there.
Thank you, Caroline. And Lynn, Lynn Blair, I don't know if your comment was related to this matter. Yes. Or other comment. Is it?
Yes, it was. It was just to reiterate what Caroline was saying. It was just to say that we do have an improvement plan for the care home, and they have had some training from the infection control nurse, and we do sort of look at the care homes in those situations on a weekly basis, and look at them at our groups, the oversight group. So just to.
Okay, is that okay with you, Pat?
Yeah, that's great. Thank you. Thank you, Eric.
Thank you very much. Thank you for your question. We're moving.
Could I just say that I'm having a problem typing in the fact I want to ask a question, but I would like to make a comment or ask a question about the mental health hub before we move on. It was about Callum's question there.
Okay. So if you just want to be, I'm conscious that we're already miles behind where we should be in the agenda.
Be brief. It's just that he did ask a question if this was going to be a physical hub, and all that was said was, all these things that were opportunities that there were going to be, but I still don't know if this is going to be a physical hub where mental health sufferers can actually walk in and perhaps have a coffee and an opportunity to chat with one another and give peer support. Is that not the type of hub it's going to be?
Do you want me to respond to that?
Yes, please. Yes.
Yeah, it would be our intention, Maureen, absolutely, that it would be a physical hub. If that answers your question.
Okay, thank you for that. You okay with that, Maureen? Yeah.
Yes. Thank you.
Okay, thank you. Okay, so a final comment, I think, from and Sandra Alder. Apologies, you've had to wait for ages to make your comment, and thank you for confessing into it being a comment rather than a question, which would have got you in earlier. So I appreciate that. If you want to go ahead with your comment now, thank you.
My comment, thanks very much. So it goes back to Councillor Duff's question around cancer diagnosis and treatment. So it's from two aspects. Grant Archibald made reference to the drastic drop in acute referrals of around 75%. But some of the anecdotal feedback that's been coming has been the impact that the patients that are presenting are having on staff morale and welfare, mental welfare. Just that the patients, and many of the patients that are presenting, are much later in their diagnosis, and the ongoing impact of that is maybe something that I'm sure the IGB and the Health Board are considering, but really just to take into account, particularly linking back into then the discussion around mental welfare. The other aspect of this, and it's been touched on a little bit as well, is around third sector support. You know, we've heard on many occasions at IGB meetings in the past, but just the very positive impact third sector support has, and the input to services in Perth and Kinross and Tayside wide. But we're very aware of a number of, particularly the larger cancer charities, whose staff have been furloughed. And there are doubts with in some of these services whether they will pick up again. So it's really just from an IGB perspective to feed that into our planning moving forward about how some of those services that are currently provided by the third sector are going to be provided on an ongoing basis. There was an announcement just a couple of days ago with another Blood Cancer UK are massively scaling back their presence, and as I say, there's concerns that many of the UK-wide charities that have Scottish branches, these maybe aren't going to be opened back up moving forward. Thank you.
Okay, thank you, Sandra. Thank you for that. I don't know if any senior officer wishes to make any comment back in relation to the points made by Sandra there. I shall offer that opportunity for anyone.
Well, I would merely just wish to acknowledge Sandra's comments. I think it's really important that we are attentive to the issues around staff wellbeing and staff welfare and the impact that their work and their experience of COVID, and as you described, patients perhaps presenting later may have on their ability to provide the care that they would wish to, and we would wish to support them to provide. So that's a point well made, Sandra. And certainly also there's a recognition nationally, and we need to be attentive to this locally, of the impact of COVID-19 on the sustainability of not just local providers but national charities and national providers. And I know that there are discussions taking place at a national level with government around some of those bigger charities and what implications COVID has for them. So we need to keep an eye on that and think about what we can do to provide any support we might be able to.
Okay, thank you, Gordon, and thank you to everybody. I think that's been a comprehensive discussion, questions very thoroughly answered, etc. So thank you to all involved. We are unfortunately now around about 30 minutes behind schedule. I'm going to take a comfort break now, but if I can ask for it to be 5 or 10 minutes, we'll come back about 12 minutes past 11. And can I ask you all to stay online, do not hang up, whatever you do, and remain in, as Chris has put in the meeting chat just now, remain in the meeting, put your microphones on mute and your cameras, if you have them, on mute as well, but please do not lose the connection. When we come back, just finally to say, I'm conscious that Grant Archibald has to leave the meeting at 12 o'clock or thereabouts, I believe, and so what I would like to do is to change the agenda order to accommodate, make sure that Grant is able to be present for the discussions on mental health services, so therefore I'd like to move to that item on the agenda when we come back, and then revert back to the item 5 and item 7 on the agenda after item 8, if the board is okay with that. Silence will, I shall assume, consent to that change of order. Okay, so thank you very much. I will reconvene in 7 minutes' time. Thank you. Okay, I hope everybody is back online. I'll give people a few seconds just to resume. This committee is now off recess and back in session. And we shall move on. As I say, I'd like to change the agenda, should I say, and move on to item 8 on the agenda, which is an update on developments in mental health services, provided again by Gordon Patterson, Chief Officer. Gordon. Or not, as the case may be.
Sorry, thank you. Thank you, Chair. Apologies for that slight delay. I'm also having technical issues, but that shouldn't preclude me from hopefully introducing this report. So this report, as indicated, provides an update to the IJB in relation to developments in mental health services, both locally in Perth and Kinross and across Tayside. This report, so I presented this because I think a recognition of the high levels of interest in mental health and mental health service delivery and development from the IJB consistently, both out of a commitment to ensure that we are providing the most effective support, care and treatment to people with mental health issues in the area, but also because of the IJB's role for the strategic planning and commissioning of inpatient mental health services. Members will remember that Kate Bell, as the Interim Mental Health Director, presented to the last meeting of Perth and Kinross IJB. And the first 2 sections of my report and the accompanying appendices really provide an update on the work that Kate's leading and coordinating in relation to Listen, Learn and Change, the response and action plan in response to David Strang's independent inquiry report, and also the Tayside Mental Health and Wellbeing Change Programme. I know that Kate would be keen to return to our September IJB or to a development session to further engage or advise the IJB on progress in this regard. The report also provides an update on our response to the ministerial announcement that inpatient services should be led by NHS Tayside rather than by an integration authority. And this has coincided with an expansion of Kate Bell's role to take on that operational responsibility for those services from the 15th of June. The next section of the report advises IJB members of the publication of the findings of a review that was carried out by Healthcare Improvement Scotland, which looks at the performance of community mental health teams and their interface with other services, as well as people's experience of accessing these services. The Healthcare Improvement Scotland review report highlights some areas of good practice, but also identifies areas of improvement, with a number of those coinciding, perhaps not surprisingly, with some of the findings that were in the independent inquiry report. Particular issues around supporting the medical workforce, ensuring that we're recruiting and supporting locums, and a need to address some of the inequity of service provision that was identified through Healthcare Improvement Scotland's review. There are a number of other recommendations, and we are bringing forward action plans to address those, including a session that's taking place in a couple of weeks' time that Kate Bell's coordinating, bringing in all the partnerships to ensure that we are able to make progress in relation to those areas identified in this Healthcare Improvement Scotland review. The final sections of my report relate to more local activity in terms of our response to COVID-19 and a reference back to the item that we've just discussed. An update in relation to our plans around the development of a community mental health strategy in Perth and Kinross, and in particular a request that the IJB consider whether or not we can defer the production of the strategy because of the priority we're giving to advancing the the operational actions that we're taking. That seems all the more sensible given that the work that Kate Bell's leading will be about the development of a pan-Tayside mental health strategy, which we would wish to interplay into, and we'll be critically involved in shaping the delivery of that strategy through the work of both Evelyn Devine, who's with us today, and Chris Lamont, one of our locality managers. The final section of the report is a brief summary on the ways in which we have committed Action 15 money. This is again because this is an issue that has arisen at previous IJBs. I know, I hope she doesn't mind me acknowledging, particularly by Maureen Summers, one of our members, and I know that Maureen's had some discussion, or was planned. A discussion was planned yesterday. Hopefully, it went ahead with colleagues to provide Maureen with a bit more detail in relation to how we are using Action 15 money to increase the workforce, to improve the availability of service, and to deliver better outcomes for people in Perth and Kinross. I shall stop there, and I'm very keen to take any questions, as I know that this is a paper that will be of great interest to IJB members. Thank you, Chair.
Thank you, Gordon, and I hope also we do have Grant Archibald on the phone as well, and obviously Grant is heavily involved at the top of the tree, so to speak, in terms of mental health services, so may be able to contribute. And Grant, please feel free to come in at any point in time should you so choose. As before, we are going first of all to questions, and I'm going to be a little bit more strict than I was on the previous item here, and please keep your questions short and the answers relatively brief as well, as we try to move the agenda on. Thank you. But Councillor Purvis, you're first.
Thank you, Chair. My question relates to the ministerial announcement and the transfer of some of the responsibilities to NHS Tayside. I know that I have made my views known on this before. It certainly wasn't my preference that operational management was transferred, and I would have preferred, as I have previously suggested, that either a head of inpatient mental health or director of inpatient mental health were in the Health and Social Care Partnership. Although my question specifically relates to, there seems to be a new development, which is the transfer of budget responsibility to NHS Tayside, despite the fact that we, as an IJB, still retain strategic responsibility. To my mind, this is not a situation that is analogous to any other organisation. A council, an NHS board, a company board, a charity board, when setting their strategic objectives for the company or organisation, would also have the responsibility of setting and approving that budget. I do not understand how we can continue to set the strategic direction if we don't have budgetary responsibility. Now, in the report at 5.2,
sorry, Councillor,
this is a question, but it does require preamble, Chair.
Be brief, please. Yeah, thank you.
Well, I'm sorry, but I think this is ridiculous, the cutting down of questions. You do require to give some context in order to answer the question.
Yes, I'm sorry. If I can just come back there, I do not believe it's ridiculous, and I would like you to recognise the fact that we are trying to move on an agenda. I appreciate that you're entitled to a preamble, and I think we've had the preamble, and I would ask you now to move to the question.
I'm trying to ask the question, if you let me finish. At 5.2, it says, following discussions with Scottish Government and Tayside executive partners. So my question is, has this change in terms of budgetary responsibility been imposed on the IJB, or have officers agreed to this without consulting the IJB?
Okay. Gordon?
So the situation that we have is that the budget is not a budget that informs or is an investment into any major change programmes in relation to the refurbishment of wards or the redesign of services. It's the operational budget that includes the payment for staff, the way in which services are operationally delivered, and the conclusions that were arrived at were that it was more appropriate that that budget be held by the person who was responsible for the operational delivery of the services. I think that that is a recognised approach. I would draw a distinction between what I've described as that operational budget that cover, and I may invite Jane Smith to come in here to provide a bit more detail about what's contained within that budget, as distinct from any investments that would be needed to support major redesign. So for that reason, the collective view was that that should better sit with whoever had operational responsibility, and as that is transferred back to NHS Tayside, the budget should go with it.
Thank you. And Jane, do you have something to add?
Thank you, Chair. I suppose I would add, recognise that this is a unique situation, and that the further discussions that I certainly and Stuart Lyle would wish to have would look to reconcile operational financial management with strategic financial management responsibilities. The impact of COVID has meant that we've not been able to have those discussions, but I recognise this is a unique situation that requires further discussion.
Thank you. And Grant Archibald, are you able to add anything to the discussion? Looks like we may have lost. Sorry, Grant, if you're on the phone and you're on mute, you have to press *6. Nope.
Can you hear me now, Chair?
There we are. Yes, thanks, Grant. Yep.
Yeah, I was just reflecting, Chair, that given the councillor had been concerned previously that he got 3 answers, or somebody gave 3 answers to a question, I think my 2 colleagues have answered this one adequately, so I support what they've said, and I think it makes sense.
Okay, thank you. Thank you. Okay.
I still can't master this question thing.
Okay, bear with me, Maureen. Maureen.
It's about the Action 15. There's a lot of conflicting figures given here. At the last meeting of the IGB on the 29th of May, Jane said that there was £19,000 left. Yesterday at the discussion and going over some of the figures with Chris and Nick and Callum, not Callum Purvis, another Callum, I can't remember his second name. But anyway, they said, when I asked the question, how much is actually left in the pot, I was told 76,500. And it's just to really get an accurate figure of what's actually going on here. Also, I did the sums. If you look at the chart, the on page 46, the figures don't add up. Just arithmetical, really. When you add up the figure for the first year and the second year and take away the 764,000 that was spent, I get, 239,208, and yet the variance carried forward was 238,611. Now it's only, in the background scheme of things, it's £597, which might not seem a lot, but it's just what's happened there. Also, later on,
sorry, Maureen, can I just...
They talk about a variance of 44,000, which seems to have disappeared because further on there's a variance of 238,611, which doesn't include that 44,000. So I think they need to go back and look at the figures again,
Maureen, thank you. Thank you for your question, and can I again ask all members please to be brief and ask questions at this point as succinctly as you possibly can. And if I can ask Jane Smith please to come in now and answer this. Thank you.
Thank you, Chair. Thank you, Maureen. First of all, in relation to your query around figures quoted at the previous meeting, my response at the last meeting was in relation specifically to the money held in the IJB reserve, which is fully committed. What the conversation at the last meeting did not cover was the fact that the Scottish Government themselves, due to their own cash flow management issues, are indeed holding on to unspent allocation right across Scotland. And what this report summarises is both that held in our local reserve and that being held on our behalf by the Scottish Government. So I hope that answers the first question, Maureen. The second issue you've raised is around a very small error in our spreadsheet. I acknowledge that and have spoken to the finance manager involved, who has indicated that's purely a result of the fact that we have used Scottish Government allocation figures, which subsequently changed slightly, and that's not been picked up, so apologies for that. In relation to the general comment that our figures don't add up, I don't accept that, and I would be very happy on a personal basis, Maureen, in follow up to the very detailed meeting the officers had with you this week, to sit down with you myself and go through these figures with you.
Thank you, Jane. Thank you. Councillor McDade.
Thank you, Chair. I do think that this is an incredibly important issue and we shouldn't be shutting down discussion around it. I have two questions. I'll ask the first one and then you can come back to me later on to ask the second one. My first question is a follow-up to Councillor Powers' question, and it's to get clarity from what the Chief Officer said in his answer, which is, I don't understand what the difference is between an operational budget and any other budget that we oversee. And he also referenced in his answer that had been a consensus decision. That was roughly his words. And I still don't understand who is involved in that.
So just to clarify, officers were involved in that decision, and it seemed as if because every other operational budget is held by the operational manager, that would naturally be the approach that we would wish to take here. The distinction that I would wish to draw in terms of budgets is that this is the day-to-day running budget. This pays for the staff, this pays for supplies and services, this pays for the operational delivery of the service. That's distinct from any budget that may be required and has previously been required in relation to capital investment or refurbishment or redesign, which is where aspects of the strategic responsibilities and the previously agreed redesign programme would be funded from. And again, however, those budgets have always been maintained by NHS Tayside because the Health and Social Care Partnership does not have capital. So just to provide that clarification, I recognise that the councillors have expressed a concern about this. I hope I've provided some degree of assurance. I would not want to necessarily get into the detail of all the lines of that budget, but those pay for the services that are now the responsibility of the Interim Director for Mental Health, and/or they also include the payments, the budget lines that support the provision of clinical staff. So the Associate Medical Director has a locus in relation to how that budget is deployed to deliver medical services, including through the additional expenditure that's been incurred employing locum doctors, which we've previously referenced.
Okay, thank you. And Councillor McDade, I think you have a follow-up question to this.
Yeah, thank you. I think it might perhaps give clarity, because my issue is not, I don't know if I disagree with it yet because I don't necessarily understand it. So perhaps, Gordon, you could maybe give us a comparison with other services that we oversee and how this is different so that I can understand, because I understand obviously the budgets are managed at an operational level for everything at some stage, but what I just want to try and get to is the crux of what this change actually means in real terms. So can you maybe compare it with some of the other budgets that we oversee, or perhaps I see Jane Smith wants to come and maybe she can provide some context.
Jane, are you able to comment further?
Yes, just following on, Chair, from my last comment, this is a unique situation. I would absolutely acknowledge that in normal circumstances, strategic financial planning responsibility does go hand in hand with operational management, but we have a situation here where those are now, there is a gap between those. It's absolutely possible that these two things, and they will have to be reconciled. The comment I gave earlier was that we still require to have the discussions that will allow us to reconcile that and provide answers to the questions that you're raising today. And that's a timing issue alone, but that unique situation that we're in, it's fully reconcilable. That should allow the IGB to fully fulfil its strategic planning and strategic financial planning role. But I can't answer your detailed questions today until we've bottomed that out.
Thank you. Thank you. Now, there's nobody else put up any other questions, although I think Councillor McDade, you possibly have a second separate question to answer. Am I correct? Yep. Fire away.
Yeah, so my second question is about how we're going to shift the balance from acute to community if we aren't overseeing this area, this budget area. I do thank you to Ms Smith for her answer. That has helped clarify it a bit further for me.
So I'll take that question. I mean, I think the ambition across Tayside, including the three health and social care partnerships and NHS Tayside, is clearly stated in the action plan and the statement of intent. And often it is recognised that the focus, including by respective chief executives, the focus needs to shift from the 6% of people who require hospital care and treatment as inpatients to the far more significant number of people who require to be supported to remain well, to remain in their local communities, to remain connected. So there is a very strong commitment that we shift the balance of care, but essentially what needs to happen in the first instance is the development of this Tayside-wide change programme and strategy, which will bottom out the extent to which we've got the right numbers of beds and the right numbers of places providing the right number of care, at the same time as identifying what are the opportunities that might exist to address some of the inequalities in relation to admissions to hospital. We know that some areas have higher numbers of admissions than others. We know that some patients from some areas stay for longer than others. So clearly there's an ambition to think about what might the community infrastructure be and how do we consolidate and develop that so that we can only keep that number of beds that we need for those patients who need it when all else is unavailable to them, and so that the provision of that inpatient care is of high quality and is enabling people to remain well looked after and thereafter able to return home as quickly as possible. The same sorts of approaches that we've taken in relation to acute services elsewhere, a very strong ambition that we get the community infrastructure right, that we prevent avoidable hospital admissions, that we reduce length of stay and we support people to get home. And we see that getting home and being supported at home as something that the health services can do, something the social work and social care services can do, and critically something that the third sector and communities can do in order to support people at home. I have no concerns that the operational changes that have been made will in any way mitigate against our ambition to achieve that shift in the balance of care. And I think I can confidently speak on behalf of colleagues who recognise that that is the destination that we're trying to get to, and that the strategy, the action plan and the change programme are the vehicles for doing that collectively.
Okay, thank you, Gordon. Is that okay, Sander?
Could I just follow up on that? Sorry.
Bear with me a second, Maureen, sorry.
Yeah, I mean, I've heard the answer, so we shall obviously wait and see now that there has been this operational change, whether that improves things or not. Only the next few months and longer can can show. So we shall wait and see, and hopefully Gordon can provide us with an update on that at the next IGB meeting as to how this shifting in the balance of care is going.
Okay, thank you. Thank you. Okay, now, Maureen, did you have another question?
Yes, it was. It was just to say that the bulk of the Action 15 money has been spent on new posts, you know, for the in the community, and that's great. There's 20.5 out of 21 posts in that already committed, and apparently they are making a difference. Although they acknowledge that there still isn't enough there. But what I was worried about is that they've earmarked the Action 15 money until the end of the period of Action 15 in 2022 for the salaries for these new staff. Now, what is going to happen to keep these staff on? Is that going to come out of the main mental health budget? And the answer I got when I asked that was, well, with the savings that we have from the inpatient beds, but surely it shouldn't just be down to how much is saved on inpatient beds. That's still, you know, an unknown quantity yet. So how can they?
I think we've got the gist of your question, Maureen. Thank you. And Jane, I think has got an answer for you.
Right. Okay.
Thank you, Maureen. Thank you, Chair. The Scottish Government continued to be very clear that Action 15 funding should be considered recurring funding, and have absolutely supported the recruitment to posts on a permanent basis. So there's very little risk at the moment, if any, that there will be a requirement to underpin all of the important investment in community mental health services further down the line. Okay,
thank you for that, Jane, and thank you for the question, Maureen. Okay, there don't appear to be any further questions at this point, so I'm now more than happy to open the floor to comments on this paper. And first up is Councillor Purvis.
Thank you, Chair. I have a number of different comments to make. I'll start with some of the other issues and then return to the community mental health services and the specific recommendation in the report later. And first on the Listen, Learn, Change plan and the response to the independent inquiry report. I do think it is always important to say when we have seen improvements, and I would certainly say that we have seen some in progress in this area, both in relation to engagement with the Integration Joint Board, but also having spoken to various stakeholders, including service users, carers, and various third sector groups who are involved with this, that they feel that the engagement has significantly improved. The only caveat I would give to that is that building up this trust is not something that we can only do once. It's a long-standing development, and if we don't see action soon on some of the recommendations from the report from the independent inquiry that are included in the action plan, then I think we might see a regression in that. So just to say that I do think there has been progress, but I would hope that that can continue. Just in relation to in the report on 6.3, and I have raised this before, I do think it's really important that we are clear whether the Integration Joint Board is agreeing to something. I'm not sure that the Health and Social Care Partnership should be welcoming a review. I think that is the role of the Integration Joint Board, and obviously as this is the first meeting since that has been published, we have not had the opportunity to do that. And while I'm not saying that I don't welcome it, I do. I think that we need to make sure that the appropriate steps are taken in relation to that. Returning to the issue about the funding and the budget, I have to say in the strongest terms that I'm very disappointed about this change, particularly given that we have now heard that discussions have taken place. An IGB responsibility has been given away without our knowledge or consent. I note the points that the Chief Officer and the Chief Financial Officer have made, but I don't think that they are sufficient to address my concerns. Obviously, one of the major goals of health and social care integration is to shift the balance from acute settings to the community. We've seen before in budgets where a reduction in beds has been put forward, for example, in inpatient mental health services. Obviously that saving is generated from staffing predominantly, and that is now being classed as an operational budget. So I don't understand how we can continue to set the strategic direction and shift the balance, which does include the shifting of funds, which previously and rightly has been our responsibility with this change. I would like to follow that up further and take up the offer from the Chief Financial Officer to have further discussions once she has a greater understanding of how those arrangements will work. Finally, returning to the community mental health services, again, I would say that from the previous report, the Chief Officer's update on the mobilisation plans, there were some very welcome and positive suggestions in that update on community mental health services, although I am very concerned about the recommendation in this report to delay the community mental health strategy further. I know that it's been very difficult and that staff have had to be redeployed to tackle the coronavirus pandemic, and while, as others have indicated, we shouldn't be complacent, the incidence of the disease is now much lower, and we're starting to remobilise our services. I think given the commitments that we have given to carers and service users, it is really important that we are seen to do our part, along with NHS Tayside delivering the action plan in collaboration with the IGBs, that we as Perth and Kinross IGB and Health and Social Care Partnership deliver that community mental health strategy as soon as possible. So I would like to ask the Chair whether he would be happy to either remove or amend that recommendation to not delay that for a further period of time. I think that we would be letting down some of the service users and carers that we have given quite strong commitments to at previous meetings if we were to delay this further today. But I'm happy to have further discussion on that. Thank you.
Thank you, Councillor Purvis, for your comments, and your points are clearly noted. Before I respond on that final point, I'll take on board any further comments that are made at this section, and then we'll come back to that if I may. And Councillor McDade, I think you're next. Thank you.
Thank you, Chair. I support everything Councillor Purvis has just said. I have, I'm disappointed that we're yet again in a situation where essentially there's a governance issue here, and I really find it very frustrating that we're still having a lot of the same issues that we've had through a number of years, and I'm hoping that this is going to be a turning point and that we are going to start making progress, real progress for the service users that access these services. But without strong governance, I don't think that actually is possible. And I was in a meeting recently where there was information, there'd been statistical analysis done of companies that have strong governance, have much better services, etc. And I think the same applies in the public sector as well. Where there is strong governance, there's going to be better services. And I think that the fact that the IGB was not consulted about this when it should have been is unacceptable. I think that I appreciate, and I now do understand, following the Chief Financial Officer's statements, of what has actually happened here. It doesn't mean I agree with them, but I do understand it now, and I would welcome some more clarity as to the detail of how they see this going forward and how they see us having that strategic input given the change in budget. And as the Chief Financial Officer identified, this is a unique situation, and therefore it is going to require a bespoke solution which the IGB members absolutely must be part of. And I hope you as Chair, Councillor Drysdale, will ensure that happens. However, I think that going forward, we hope that this will now lead to improved service delivery, and I would like to ask at this point that we continue to receive an update on this issue at every IJB meeting for at least the rest of the year, and really going forward, because I think it's such an important issue. It has been such a huge issue for us in my 3 years on the IJB, and I can't see it not continuing to be so. I think we need to have sight of these matters, and I also think it is important, as I've already said, that IJB members are involved in the ongoing discussions that are now about to continue.
Indeed. Thank you, Councillor McDade, and also, I guess, in response to Councillor Purvis's comments as well. At this point, what I would say is that I too have expressed concerns about the understanding the changes in governance that are happening here, and I have asked questions and raised issues as the council representative on NHS Tayside board as well, when this matter has been being discussed at these board meetings, and yes, we absolutely do need complete, we need involvement, and we need clarity on the issues that you have set out. All I would say is that we are on a journey here, and it's a unique journey. In very difficult times with constraints due to the pandemic, etc. I'm not using that as an excuse, but as a reality. I think things would have happened more smoothly and more quickly had we not been prioritising the COVID response. But I absolutely concur with your comments that we do need to resolve the finance, elite governance issues that are arising and have arisen as a result of this this journey that we're on under ministerial direction. Councillor, sorry. Your councillor there, Bob Benson, but Mr. Benson.
Thank you, Chair. I'm not yet a representative in the Perth and Kinross. Some of what I was going to say, Chair, was actually conveyed by what you've just said a moment ago. But I think also you recognise the uniqueness of this period, and I do think it might be helpful if we're able to restate what the delegated powers are and the implications for governance at some stage, and what is their likely duration. And I think that would be helpful, I think, for all members of the board to understand what are the constraints within that, and understanding what the ongoing responsibilities and powers of our governance arrangements are during this quite unique situation.
Okay, thank you. Are there any further comments? Does anybody wish to come in here?
Could I just make a comment on the strategy, and the action plan, or the draft action plan, was put to the stakeholder participation group, which came out of David Strang's report, and it's made up of people with lived experience. And the draft action plan was presented to them at a meeting the day before it was to go to Scottish Government. Now, that's unacceptable. There was no chance to read it, digest it, make constructive comments on it. And what we don't want is for the mental health strategy to go forward in the same kind of fashion that it's just got to meet a deadline. We have to get it right, because this strategy is going to be the way things are going to work for the next so many years, so we have to get it right. So that was just my comment. But I mean, the stakeholder group were very disappointed at the way that they were presented with this action plan, which was a response to David Strang's report, with no time really to digest it or make comments. So we have to make sure that the stakeholders and the people with lived experience do get a chance to comment on all these important documents. Okay.
Okay, thank you. Thank you. Okay, so if there are no further comments at this point, the easy bit first of all, can we note the developments that are being progressed locally and across Tayside in respect of mental health services? I'll take silence as agreeing to note that. As regards the second element of the recommendation, I'll just read out the recommendation, which states to approve the proposal to focus on the delivery of urgent action in response to COVID-19 this year, and to thus defer the production and publication of a local community mental health strategy, and that isn't dated there. What I'm going to suggest here, and I invite members to either to comment if they see fit. What I'm going to suggest is we do have, if we go forward to the forward planner at item 10 on the agenda, it had been intended for this to be an item for discussion at the October development session. I wonder if you would agree that I should take this offline and speak with Mr. Patterson and others and seek to accelerate the timetable for the progression of this item in as much as we can. I can't obviously give a specific timescale for that, but we do have a slot in August as well. We may get some progress in that regard, and we should perhaps have this item on the agenda at our August meeting to see what progress has been made within that relatively short time frame. Councillor McDade.
Thank you, Chair. Yes, I think I would welcome that approach that you're discussing there about expediting the timetable here. I think that this important issue has gone on for quite long enough, and whilst I appreciate that there are still COVID-19 pressures, the people who experience these services have had this going on for a lot longer than COVID, and indeed it's been an issue for as long as you and I have been on the board. So I think from my point of view, I would like to see us make progression, and I think that, as you discussed, if you could take the matter offline with Gordon Patterson and see if we can bring forward a speeded up timetable in relation to this matter, perhaps have a discussion at that August development day that you were talking about, and look to bring it back thereafter.
Okay, I have Evelyn Devine.
Yes, Councillor Drysdale, we have been moving towards the local strategy for mental health in terms of community services. However, we're also populating a significant amount of groups in relation to how the Tayside-wide strategy will move forward. And if we look at the themes in the Tayside-wide strategy, we're making great efforts to ensure that the priorities that have been agreed within our consultation engagement sessions in the last few years are absolutely threaded through the Tayside-wide strategy. So we have good mental health for all as one of the themes, and the other one being primary and community mental health, which covers the access to primary care, Action 15, etc., etc. So there's a capacity issue for us in relation to populating and making a really good job of the Tayside-wide strategy and making sure Perth and Kinross well represented there, and developing the local strategy at the same time. So I think I just wanted to put some context around that, because there's a significant amount of work going in from officers to support the setting up of a lot of these work streams.
Yeah, that's understood and that's helpful, Evelyn. Gordon, you have something to add as well?
Yeah, sorry, I seem unable at the moment to get into the chat function, or maybe I have and it hasn't registered. I think there's maybe a time lag. So just to build on Evelyn's point, I think if the ambition of the IJB is that we produce a strategy, then we will prioritise that. I think the strategy is really not what people in Perth and Kinross with mental health issues are holding out for, because the development of the strategy is going to dedicate time and resources to the production of a strategy, and that's time and resources that I suppose this proposal would rather we were diverting towards delivery and action planning and responding to COVID. But we can do that if that's the preference of the IGB. I think the challenge there will be whether or not we should be looking at these proposals from 9 voluntary organisations to develop local services, or whether we would instead be looking at what would their vision be for mental health services in Perth and Kinross in 3, 4, 5 years' time, which I personally think is an unrealistic challenge in terms of not knowing how COVID is going to impact on how those services in the longer term may need to be configured, let alone how that coincides with the development of a Tayside strategy. So apologies to members that I perhaps haven't articulated that clearly enough in my report to inform the discussion, but I wish to make those comments at the moment, because I think a strategy will be produced but something else won't, because of the limited finite resource that we have. And we had anticipated that we would wish to prioritise action and delivery in these exceptional circumstances that we're working in for the rest of this financial year.
Thanks, Gordon. And yeah, I mean, I appreciate the huge demands on yourself and your team in relation to the various plates that you are spinning. And but obviously there is, on the other hand, the desire on the part of the board to be seeing as much progress on this issue as we can, as well. Councillor Purvis, you have a further comment?
Thank you. It was just to pick up on some of the points that have been raised. I accept the point that the Chief Officer has made about wanting to ensure that we are delivering services at the moment. I do think it's a bit unfair to suggest that because of that people aren't interested in a long-term strategy. I think from certainly my experience speaking to people is that while they're not particularly bothered about calling it a strategy or however we describe it, there is a clear need to set out what the community mental health infrastructure is in Perth and Kinross, and to allow us to do that work to shift the balance. This is something that has been talked about for a long time. It was certainly referenced in the interim report for the independent inquiry, and the fact that we needed to audit the community mental health infrastructure that we had, and obviously not to go over the old ground on that. We agreed it on the 6th of November last year, which is about 4 months before we were really into the pandemic situation. And as I said, while I completely appreciate the pressures that people are facing, I think if we continue to put this off and off and off, then we're just, every time it's not going to be a priority. And we've said that this is a priority because the community mental health services, while significant developments have been made, we've seen from independent reports and reviews that they are not good enough at this moment in time alongside the inpatient mental health services. And if we continue to neglect this issue because other things always take priority, then we're never going to solve these problems that we have committed to solving. So it's not about stopping the other improvements, which, as I said in my comments a little earlier, are very welcome, and some of the things that we've been asking for quite some time, and I completely support officers in doing that. But we have to make progress on this, and we cannot continue to defer it. And I support the comments that the chair has made, but just to say that I would really like us to have something within this year. Thank you.
Well, again, yeah, and so would I, Councillor Purvis. And it's this comment, this word that's been used repeatedly this morning, which is ambition. It may not be possible to achieve our ambitions, but it doesn't mean to say we don't try and move towards them insofar as we can. I have to say, I hear both sides of the discussion here. My own personal view is, we it's not that nothing has been done. If anybody listening is getting the impression that nothing's been done on mental health, nothing could be further from the truth. There's a huge amount going on. It's complicated, and but we do need to make progress. So I think with the board's agreement, what I would like to do at this point is to note the we've already noted the developments, and note that there are challenges in resourcing sufficient work towards a local community mental health strategy alongside other priorities, but asking the Chief Officer and the Health and Social Care Partnership to make what efforts is reasonably possible to do to progress that as swiftly as possible, with a view to something coming back to the board at the earliest opportunity. We have, we, as Mr. Patterson has already mentioned this morning, we hope to have Kate Bell with us at the September IJB, and clearly we're going to have a substantive discussion at the September meeting. In the meantime, I think if an update, whatever that update is, can also be given to the August development session as an interim report, if you want, and we can debate further at that point in time, how we see the progress, and whether the progress being made at that point is at least heading in the right direction. I think that's the best sort of pragmatic outcome to this debate, unless anybody is otherwise minded. We'll close the debate at this point. So thank you for that. Okay. So now we're going back to the future, and hoping that Jane Smith is with us, and that we can revert back to item 5 on the agenda and the finance update. Jane, if you could briefly recap on what we said, what you said before we left, or you left us earlier, and complete your report. Thank you.
Thank you, Chair. It's difficult for me to know exactly where you lost, or where I lost contact with you, so I may just quickly go through the brief update. So to repeat the earlier points, we reported to the IJB in May and indicated a very first draft estimate of cost of 7.1 million. We've continued weekly to update those costs, and the paper that Gordon has presented earlier on the agenda set out the latest forecast submitted to the Scottish Government of £9.4 million. However, this doesn't take into account the outcome of the detailed Q1 review that's still going on, and that will identify potential offsets to forecast expenditure where we have services that have had to step down in the face of the COVID pressures. We will submit a further Q1 forecast to the Scottish Government in the middle of August. At this point, we've only received £1.4 million of social care funding. There have been another number of other commitments to funding, but that's all that's been received by the IJB at this point. They're very conscious that IJB members will wish to understand the financial position and financial implications of COVID at an early stage, and we will bring forward a formal update to the August meeting. However, at that stage, clearly it won't include the outcome of the Scottish Government's own discussions and the additional allocation that we may receive.
Okay. Thank you, Jane. I appreciate your update. Are there any questions for Jane at this time? Nope, we don't appear to have any questions. Oh, no, we've got a comment from Gordon.
No, I think I just wish to clarify that when Jane was talking about the next IJB meeting, she should have said September rather than August. The August meeting is a development session and is in a fortnight's time.
Indeed.
Apologies.
Okay, yeah, no, thank you for that. Is it just 2 weeks' time? Is that right? Okay. Right. So thank you for that. If there are no further questions, any comments? No. Okay. If we can just agree to note that report. Thank you, Jane. Therefore, now moving on to item 7 on the agenda, and that is the Audit and Performance Committee update. And I would ask at this point Councillor Purvis, who is Chair of the Audit and Performance Committee, to give a verbal update. Councillor Purvis.
Thank you, Chair. I'll try to keep this reasonably brief. At the last committee meeting, which was held on the 22nd of June, we discussed a number of different areas. In relation to the performance section, much of that had also been discussed at the IJB in relation to the Health and Social Care Partnership's response to the COVID-19 pandemic. And indeed the financial position as it was at the time. Obviously, we had made significant progress on the financial recovery measures, only for the coronavirus to introduce some new challenges. In relation to the publication of the annual performance report, given the operational requirements as a result of the coronavirus pandemic, and we did agree to allow that to be deferred to the next meeting. Hopefully that will come in September. On governance and assurance, we had the internal audit, annual report and assurance statement, and the chief internal auditor stated that she had could place reasonable reliance on the IJB's governance arrangements and the systems of internal control, which was positive. We also had an update on the internal audit reports, which again have been delayed due to people being redeployed as a result of the coronavirus pandemic. But we do hope that we will get some updates on that at future meetings in the near future. We also had an update on the strategic risk management plan. A separate strategic risk management register has been introduced for risks specifically associated with coronavirus. And while that was not brought forward to that committee, and we did ask if that could be brought to a future committee. And I know that officers are looking at ways of merging those two together, the COVID-19 risk register and the existing risk register that we already had. In relation to the partnership improvement plan, we had a report from the chief officer, which built on some of the discussions that I and others had previously raised at the Integration Joint Board itself, about ensuring that there was regular monitoring of the actions in that improvement plan, and that was a welcome addition to the agenda. Finally, on this, before I come on to the annual accounts, and this does tie in with the agenda for the Integration Joint Board itself, today we agreed to recommend to the IJB that Jackie Clark be appointed as the internal auditor for the IJB for the year 2020-2021. We had asked, some members might recall previously, that we could look at other options, even if that doesn't mean that we're changing who our internal auditor is, but it is important that an audit committee is satisfied that it has explored all options in relation to that internal audit function. So that work wasn't able to be progressed given the coronavirus situation, so we appointed Jackie Clark for a further year and hope that that work will be completed when we look at the appointment again next year. Usually an appointment would be for 3 years rather than 1. So that is on the agenda as the next item for the board to consent or otherwise to that recommendation. Finally, in relation to the annual governance statement and the unaudited accounts, the annual governance statement is there to provide assurance as to the effectiveness of the IGB's governance framework. There were a number of additional suggestions and comments that were made by members, and we were able to incorporate them after the meeting before it was finalised. So I think that was very positive to have some engagement from the members of the Audit and Performance Committee on that issue. And also in relation to the unaudited annual accounts, this is slightly different from how it's been done in previous years, in line with the updated terms of reference. As a standard with audit committees, now the Audit and Performance Committee will agree the unaudited annual accounts in their draft form, rather than recommending them to the IGB for approval, which is what happened in the past. I think it's a very readable document, and these things aren't always very readable, and particularly in relation to some of the concerns that people had around the reserve position and other areas, the commentary that was provided with that was very helpful, and both that and the annual governance statement are available on the council website with the papers for the Audit and Performance Committee for any board members who were not involved in the audit and performance discussion. I'd just like to thank Donna Mitchell, Jane Smith and other officers for a lot of work that they put in to those annual accounts, particularly given the other pressures that they were facing at the time. Simply in conclusion, we were very happy once we had them explained to us, and particularly in relation to concerns about the reserve position, which I know had been highlighted in the press a few days before, and we were happy to agree them for approval to go to be audited by our external auditors. Just to remind people that everyone who is a member of the Integration Joint Board, both voting and non-voting members and stakeholder members, are very welcome to attend the Audit and Performance Committees in a non-voting capacity and contribute to the questioning and discussion. The next one is scheduled for the 14th of September, and I think Adam Taylor will again make everyone aware of that if they want to join in with that meeting. So I'm happy to take any questions.
Thank you, Councillor Purvis, for your report. That's very informative. I shall ask if there are any questions to Councillor Purvis at this point. No questions. And if there are any comments on the paper. No comments either. Must all have been extremely clear, and thank you for your report. So, just going to conclude this item. Therefore, we are noting the report of the chair of the Audit and Performance Committee and the content thereof, and also we are asked to approve the appointment of Jackie Clark as Chief Internal Auditor. In the absence of any comments in the chat function or on the telephones or elsewhere, I shall give that a few moments, but I'm minded to approve that unless anybody speaks up now. Okay, so that is approved. Thank you very much. So now we're back to where we should be on the agenda at this point, and the next item is the review of standing orders and governance. And whilst I will now ask Chief Officer Gordon Patterson to speak to this report briefly. I would also ask Councillor McDade who unfortunately Mr Erskine is not present today. But if Councillor McDade can give a substantive report and speak to the paper, that would be helpful. But Gordon, are you able to give some introductory comments?
Really just acknowledge that this is a note, I think, of a meeting that took place involving some of the members of the IJB in the context of a recognised need to bring forward some proposals around the standing orders for the IJB and to pick up on some of the issues that IJB members felt needed attention in relation to governance. It's a member group, not an officer member group, so it's probably better that IJB members describe what the work has entailed and speak to the paper that's attached, which is a note of the first discussions in this regard.
Okay, thank you, and I should also say that the clerk, Scott Henry, was involved, and Adam Taylor also, and Sarah Roger and Sandra Auld were all involved in relation to this. And by all means, ladies and gentlemen, if you wish to add comments following Councillor McDade's comments, that would be most helpful. And then after that, we'll go to questions from other members. Councillor McDade, do you wish to make a comment at this point?
Thanks, Chair. Yes, so the meeting was quite wide-ranging in our discussions, and intrinsically, due to the nature of the setup of the IJB, the standing orders, integration scheme, etc., are all heavily interlinked, and indeed at some points they are at odds with each other. So there was the note that you have before you is basically what we chose to identify as key areas for discussion. But what we felt was that the IJB itself needs to have discussion around these key themes and make some decision and give some direction around them, because they are quite large in some cases in terms of the content and the decisions that need to be taken. And then a group of the member group can actually flesh out perhaps some of the direction, but it needs direction from the IJB really, and I think that it needs to really run in parallel in some respects with a review of the integration scheme. And I think it's also worth saying that members were perhaps quite far apart on where we sat. We had a very good discussion. It was all very amicable, and it was a very good discussion indeed. But certainly, my experience of 3 years on the board was different to those who've not maybe been on the board so long, and I think that certainly will need to come out as part of a wider discussion amongst board members. So these are really just the paper you have is key themes that we identified for discussion. Each one of them is quite a reasonable chunk of discussion, to be honest. So I think that it's really, we kicked this back to the IJB to consider how they would like to progress this. I think it definitely is a development date, and also in terms of the timescale, I think we appreciated that the amount of time and effort that this would take means that it wouldn't be complete probably before the end of the year. Sarah Roger, who is a PKC legal manager, was part of the group, and she is on the national IJB legal and governance leads, and in fact I think she chairs that group, and she's asked her fellow colleagues for some advice and information as to what they've done when they've been reviewing some of these things, and we had some key points that she took back to discuss. So it was quite a, as I say, it was a good discussion. We were coming at it from different directions perhaps, and that's something that does need fleshed out by the membership of the IJB. But you get a feel for it. But the standing orders and the integration scheme are so intrinsically linked that as the integration scheme's up for discussion and renewal at the moment as well, I think the two do need to go hand in hand. I think that was the feeling of the working group. Sandra's here today as well, so hopefully Sandra can perhaps add stuff if I've missed anything.
Thank you for that. Sandra, is there anything that you wish to add at this point?
Nothing in particular other than to agree with Sandra's observations that it was a good and worthwhile discussion, but yes, very wide ranging, and the agreement of the group at the end was that we really did need some direction from the IJB on how best to take this forward, and some acknowledgement that it was such a kind of meaty but absolutely integral topic for the progression of the IJB that we need to work towards taking it forward and making some progress. I mean, one of the key things, which is a little bit ironic around some of the earlier discussions about the change of responsibilities, is around renewing public confidence in the IJB. And the importance of the key importance of good governance.
Okay, thank you. Okay, if there are no questions as such at this, we do have a question. So, sorry, Councillor Purvis, you'll have to be patient for a moment or two. We have a question from Bob Benson. Bob.
Thank you very much, Sandra, for that very helpful update. And I think it's worth noting the progress that's been made by the group. And I think, as you rightly identify, I think both speakers rightly identify how big a chunk of work this actually is, which suggests to me that perhaps you might wish to consider setting out the key priority areas that you'd want to address first. And some of these have been well reported, particularly around about finance and performance. But the other one is about looking at, setting out short, medium and longer term priorities in this that you may want to consider. A major consideration in everything that you come up with will be the capacity of the Secretariat to support any future governance arrangements. And that's a key issue, and particularly during this time as well, when there are a lot of pressures on the Secretariat itself. If I might make one helpful suggestion, is that Health and Social Care Scotland have sponsored the IJB Chairs and Vice Chairs Network Executive, who are actually in communication with all of the IJBs across Scotland. And I noticed in your last bullet point about what do other IJBs do, it might be helpful if you find a steer through Louise MacDonald, who is coordinating that on behalf of the Network Executive and reports back regularly on such matters. I think you might find that helpful. But I really applaud the progress so far. Thank you so much.
Thank you. And Councillor McDade, I think you want to come back in here.
Could I comment as well, Eric, at some point?
Yeah, by all means, just bear with me a moment. Thanks.
Yeah, sure.
Hi, yeah, no, I was just going to give a response to Bob's points from the discussions that we had at the group, which was that we did try to prioritise to a degree, but actually everything is so intrinsically linked that actually it's quite difficult, and that's why we actually felt that really it's a significant piece of work that needs to be done properly, and that we need to take the time to do that. And I think we did have a discussion about the support required to do so, and that's why we're setting out a longer time scale than might have otherwise been desired. I think previously the thought was we might have come back in September with a sort of finished document, and that certainly is not going to be possible. So we have factored in essentially the additional support time, and I think I would be saying a very loose date of December, because I think to do this right, it needs to factor in an awful lot of things that need to happen over the next 6 months, and actually it's not a terribly long time to do it properly, because what we are essentially looking at is refreshing a 5-year-old document, not quite throwing it out, but actually it's going through all of it and refreshing it and in line with the integration scheme. I think your point absolutely about the fact that there are these national groups that we can tap into, and that was recognised and very much is being proposed and is undertaken. So I do think that some of the points are, yes, slightly less important, but they tend to all be intrinsically linked. So things like subcommittees of the IGB, not actually as high a priority perhaps as the public perception of the IGB, or indeed stakeholder and public engagement, which are really important. But actually what you tend to find is that by the time you start saying, well, how do we do this, it tends to be so intertwined with other areas that actually it's quite hard to focus in on, say, we'll deal with this bit first. It does really need to be done as a complete package, and that's why we are recommending a longer timescale.
Thank you. Thank you for that, Councillor McDaden. I think the point is clear. I think there's a consensus that it's important we get this right, rather than get it done within an impossible to achieve short time scale. So I think we're agreed on that. Councillor Purvis, first of all, and then I'll come to Pat Kilpatrick and then Councillor Duff.
Thank you, Chair, and thank you to the group for bringing this forward. I think it is very difficult to disagree with any of the areas that have been identified, but I think, as both members of the group have acknowledged, that's probably because it's so wide in its scope, and things may become more challenging to try and decide what are the priorities and indeed what action should be taken later on, which I think Councillor McDade also recognised. I would support the suggestion. I don't know at what point in the process this would be most useful to the group, but to have a development session and include that as part of the work there. I know it has been on the agenda a few times, but has often been towards the end, so maybe it's something that either needs a development session dedicated to it or at the start. The only addition that I would ask whether they were willing to incorporate, which I referenced in some of my comments on the first paper, a lot of the areas to be included in the scope of the review cover committees, standing orders, agenda planning, things like that. But I think it is very important that we think about how, particularly with the changing way that we are delivering services operationally, looking to be more flexible and empower staff to make more of their own decisions, how do we link that to ensuring that we can scrutinise the delivery to ensure that our strategic objectives are being met. So I think that is an important part of governance, actually, how we scrutinise and get assurance on particular issues, while all of these other components are a necessary step to take. They're not sufficient to ensure that we make sure we discharge our governance responsibilities on that. So I would ask if they'd be willing to incorporate that. Thank you.
Okay, and I think Councillor McDade just wants to respond to that point, these points.
Yeah, absolutely, and I think I'm recall, what has been distilled here, and I'm sure Sandra can support this. What is distilled here is a very, very abbreviated version of what was an incredibly intense and wide-ranging discussion. And on Councillor Purvis's point, absolutely, I think that does fit in there. And to me, again, that's part of the fact that this is all intrinsically linked with the integration scheme and a lot of the other changes that are going on. And I think that, I mean, during the meeting, I described the Perth and Kinross offer and talked about, actually how we do that on the health social care side. And again, all of these things are intrinsically linked. So I think absolutely, I think we should include that as a point for discussion. This really is just a starter for 10. I don't think it's quite 10 points, but it is a starter for 10 basically, and it's designed to basically put it to the IJB for their opinion and for everyone to add in bits that we've missed. But we did have a discussion around that point, and absolutely, I think it should be part of the discussion.
Thank you for that. And Pat Kilpatrick.
Thank you. I just really like to support what Councillor Purvis was saying about scrutiny and assurance, but I think the one thing that's been missing, I don't know if it's missing because this, I would be a little bit concerned about is how much focus we've got on integrated clinical and professional governance. And really, I'm not trying to suggest we invent groups and more groups for IJB members to sit on, but more about the structure and the accountability to the IJB in terms of governance. And if you look at other IJBs and how they function, you'll find that a number of them do have governance groups within different professional disciplines. So older people services, or children and families, criminal justice, or mental health, or homelessness. Hosted services often has its own governance group looking at sexual health, prison health, police custody health, whatever. And it's really about an integrated governance group, which is officer-led. And all that really happens is everybody brings their own governance, assurance and scrutiny to an integrated group, which then reports to the IJB. And that's only one model. So I think there's 2 points. One is I think we need some kind of form of care and healthcare and social care and professional governance, whether it's a group or it's a substructure within the IJB. I don't think it should be IJB led. I don't think it should be and people like myself, but I think it should be officer led. But I think what it does need to do is it needs to meet, it needs to have discussions, it needs to respond to issues as they come up, and we've heard some of them today. And it needs to report and give assurance and scrutiny to the IJB. Now that would be my that would be my concern. That have we missed that? Has it come out? And can we look at it? Can we include it? So for those that are involved in this group, maybe it's a plea, I suppose, to take that on board. Thank you, Chair.
Thank you. And Councillor McDade, you've got your hand up again.
Yeah, just to respond to Ms Kilpatrick's point, I don't think we try not to be prescriptive in what is on the piece of paper, so it is designed to be open to people to say absolutely they think we should have groups of different types. It's not, we've not tried using this as this is not a prescriptive list. It's just as I say, a start of 10. Our Perth and Kinross IJB does of course have a clinical care and professional governance committee. It just hasn't met. So we have already previously acknowledged the fact that such structures need to exist, and we perhaps need to refresh that, and it would perhaps be helpful if it were to meet, I think.
Yeah, on that, I would direct members' attention to the NHS Tayside annual accounts, which have just been approved. I'm not sure exactly where you can get them online, but I'm sure they'll be there somewhere on the NHS website. And in the Chief Executive's report, there is reference to precisely this issue around care governance within health and within integration joint boards. So I think, yeah, again, this is one of these areas that we need to agree on and be, and make some progress in having a degree of oversight on this aspect. So your comments are welcome, Pat, and thank you for that. Councillor Duff.
Thank you, Chair. Yeah, I agree with the points already raised by the board members, so I won't go over these again. Obviously, this is high level, but it's very useful, I think, for the areas to be developed by discussion, and there's obviously a need for us as the wider IJB to try and focus down to assist the working group to identify the priorities and to provide a kind of tighter remit for the working group going forward. So happy to support the suggestions. Thank you.
Okay, thank you for that. And we'll come on to talk about this in the next item in terms of the development session timetable, but you'll see that included within that is a section on standing orders and governance in October. So I think that's the next point at which we can bring back discussions to the full group, and in the meantime, with the guidance that has been provided today, leave the group that is already involved in this working party to make some progress and to develop the thoughts. But thank you so much for the efforts to date. And Councillor McDade, you've got a comment to make at this point.
Yeah, sorry, Chair. It was just on what you were saying there, and I don't know if Sandra might want to come in here as well. I think the view of the group was that really we would need a steer, a significant steer on some of the key structural underpinning points before we could really progress it. So whilst I appreciate there are a lot of priorities going on, and it may be that we can't consider this matter till the development day in October, I think that will then just knock on time-wise. So that, obviously we do have to prioritise, and that's fine. But I just wanted to flag that was the view of the working group. Basically, was some of these key points really needed some strategic direction, because we felt we could probably have done a lot of the detailed work about, well, yeah, we want to put clinical care and professional governance in or whatever, but actually what we actually need is some significant strategic direction around some of these key points so that we could go away and do that more detailed work. As I say, we appreciate that there is time constraints for everyone both, and it may just be that this takes longer than we've proposed today, but that's just to sort of flag that now.
Okay, we're just losing you a bit there, Councillor McDade. You might want to go off camera just to preserve your signal. But I get the gist of what you're saying, and I wonder if we can possibly, therefore, bring this forward.
Could I come in?
Yeah, just a moment. Yeah, absolutely. Yeah, just bring it forward to the August development session is what I was going to say. But yeah, Sandra, by all means, fire away.
Yeah, and so that's exactly what I was going to ask. Might there be space at the August session? I suppose the group we could have a look at what we could continue to work on what other IJBs are doing. But as far as the actual direction and prioritisation, I really don't think we can do that much until we've had some direction from the IJB. So if it could be squeezed in August, that would be really, really helpful.
Yeah, indeed. Thank you for that. And Dr. Dougal, I think you have a comment as well.
Yeah, just a very quick one. Thanks, Eric. Just to pick up on Patrick's comment, the description she gave of the care and professional governance structures elsewhere in other IGBs is pretty much exactly what we have here, and therefore I think it would be helpful. I look forward to the development session when we can discuss that and share that with colleagues a bit more widely, because that's a group which meets very regularly and has subgroups of locality and specialty governance groups which feed into that. So if I heard correctly, I think that is fairly much what we have at the moment, but I think there's clearly developments and improvements that we can always make.
Okay. Thank you for that. Sorry,
can I
lost my. Yeah, and you come. Yep.
I mean, I'm really reassured by what you're saying, that that's pretty much the structure you have. I have to say, though, as a board member of the IJB, I don't think I've ever received a report that says this is the summary report of the Care Governance Committee. So if it's there, I think it needs, you know, to get a bit more centre stage and to get more profile, and I'm reassured that, you know, that the work's going on. I just think it's not being reported in, so board members wouldn't really know about it and cannot be assured if they don't know about things, and cannot feel that they're asking for scrutiny and assurance if they're not aware that it exists. So, you know, I think that might just be not as difficult as we think it might be. It might just be, you know, bringing it more centre stage.
Yeah. Thanks, Pat. And Gordon, you want to come in now?
Well, just to build on Hamish's points, we had intended to bring that report to this board, but felt that the agenda might not have lent itself to discussion of clinical and care governance. So instead, it was suggested that we bring that report and have that type of discussion at the August development session. So hopefully that provides then some assurance to IGB members, but also we can potentially explore how clinical and care governance needs to be reported moving forward, whether that is directly to the IGB from the clinical and professional forum that we have that meets every 8 weeks and that is overseen by the Associate Medical Director and the Chief Social Work Officer, or whether there remains a need for a committee. So just to provide that assurance, the report was due to come today, but I think we knew that at 1:45 we still wouldn't have finished the existing business without adding a further substantive item. So it was deferred for that reason.
Yeah, I completely understand, and it might not be 1:45 we're finished, but hopefully not too soon, too long thereafter. But no, absolutely, and so I think we're all in agreement though that that we should bring this back to the August development session, this whole area, and have a more detailed discussion. I appreciate we're adding a little bit to that agenda, but still, nonetheless, it's important. As with previous items we've discussed this morning, that you know, we're just trying to move things forward, but always recognising the priorities, the operational priorities that are also very significant at this time and will continue to be for the foreseeable future. So, but you know, as long as we're making progress, that's the main thing. Okay, so without further ado, if that's okay with everybody, we shall close the item at this point and move on to item 9. Oh, sorry, I beg your pardon, item 10. Which is the IGB reporting forward planner. And again, Gordon, if I can ask you to come in and talk to this paper.
Certainly, thanks, Chair. So this is a paper that has been pulled together just to advise the IGB, seek approval for the IGB in relation to the future reporting schedule. It's really just an existing document that has always been available, tended to be dealt with offline and behind the scenes rather than necessarily brought forward to the IGB, but it's been refreshed in the context of what officers have identified would be the priorities, what would be able to be realised, what's desirable, achievable in relation to various reports, what deadlines do they coincide with, which might be external and prescribed by government, and it proposes that we will bring forward the reports as indicated in this template, in the schedule. I don't know that I want to go into any great detail. Certainly, the only point that I would make is a recognition that mental health and well-being should be an item and would be an item at all IGBs, and some of the other reviews are contingent, or reports are contingent on discussions that have yet to take place or progress that we might make. The ambition being that the IGB would be clear about whether these reports were for noting or for decision, and that they should always be around our strategic ambitions as a health and social care partnership, and given the IJP's strategic oversight and direction setting. So I don't know to what extent we would wish to have a discussion about it. Probably need to avoid going through it line by line, but it's there for consideration, and maybe if people have potentially got any significant concerns about timing, obviously we will be amending the dates in relation to community mental health, then we would want to hear them so that what we were clear about the IJB's expectations of what our priorities as officers should be.
Thank you, Gordon. I just had one point myself, if I might, which was, I think when you gave your report earlier this morning, you indicated, I think you indicated bringing back the winter plan to the September meeting, but I see it's down for the December meeting in this chart. So, am I right? And is that something that is capable of being brought to the September meeting?
I could maybe bring in Evelyn Devine at this point, if she's still with us. Yeah. That was maybe me being a bit premature, but Evelyn?
Yeah, normally we bring it to the December one because it's just all the processes it needs to go through for approval, and we bring it with the whole NHS Tayside winter plan and ours attached. However, we are developing the winter plan much earlier this year, so I could get back to you on that, Councillor Drysdale, in terms of working with my acute colleagues to see when we think we would have it.
Okay,
ready to sign off.
Yeah, thank you, and maybe it can be, you know, even a brief comment, whether part of Gordon's overall report or whatever. And the reason I say that in particular, because obviously this winter, above all others, the issue of vaccinations, flu vaccinations and so on is going to be of paramount importance.
Yes.
And please God, at some point another vaccination would be good. So yeah, I mean, I just wonder, I would want to bring that into the public domain at the September meeting in some way, shape or form.
And we could bring the P&K version in it because we already have it in draft. So yeah, we'd be happy to do that. That's even good. If it's not the whole Tayside one.
Yeah, okay, good stuff. Okay, Councillor McDade.
Thanks, Chair. I think Chief Officer has basically confirmed what I was going to ask, which is that we will have mental health and wellbeing as a standing item on all agendas, and I appreciate his confirmation of that, so I'm happy.
Okay, thank you. Councillor Purvis.
My question was actually the same one, just a very brief addition. I think the Chief Officer mentioned specifically community mental health services. It was just to remind everyone of the decision we took on the 27th of September, which said that we'd have a standing item for the progress, risk and delivery of the Mental Health and Learning Disability Service Redesign Programme and the Tayside Mental Health Alliance, obviously whatever the successor body to that is now, but just to make that point that it's slightly broader than just community mental health.
Yep, thank you. And Jackie Pepper.
Thank you very much, Councillor Drysdale. I was just looking at the forward planner and the development sessions and the agendas for those, noting on our action plan that we have agreed to hold a session on public protection, and the Ad Hoc Protection Committee's biennial report and the Chief Social Worker Officer's report are going to come earlier in the schedule for reporting than they would have done normally. So really just to request that we give over some time to that important area. Probably, I would suggest before the end of September.
Okay. And Gordon, if you can take that on board and see what can be done in terms of the timetabling, and Scott obviously as well, that would be helpful. Okay, are there any other questions? or comments? Okay, thank you for that. That report is noted and approved, subject to the variations discussed. And then we come on to the final item on the agenda, which again is just, we've spoken about it so often already during the course of this morning. We have a huge agenda to get through, and we have the limited capacity of officers to support that whilst managing the pandemic response within Perth and Kinross and taking forward other projects. So we have 2 board meetings, one on the 23rd of September, one on the 9th of December, and we have 2 scheduled IJB briefing and development sessions on the 19th of August and the 28th of October. And these are all clearly going to be substantive agenda, substantive meetings as we look to progress the work of the IJB. So without further ado, I just want to close the meeting at this point and thank you all for your contributions, gratefully received. And one final point, again, apologise for the IT difficulties that arose at the start of the meeting. Thankfully, most of them seem to have been addressed and resolved during the course of the meeting. And again, we shall have a debrief on that after this meeting. And I think, Councillor McDade, you just have a final comment?
Yeah, it's just on the meetings, and I raise this at the end of every meeting, that I think we do need more meetings scheduled. And I know it's one of my constant refrains, but usually if I make a constant refrain for long enough, something ends up happening. So I'm going to continue to make it until such time as we have more IJB meetings. And I think just on your point, I think absolutely I get that officers are under pressure in terms of time commitments, and perhaps we could have meetings with less on the agenda that are more specific. So perhaps we could have a finance targeted board meeting where it would only really require the finance officers, and anything that they weren't able to answer could come back at a later date, for example, and then we could have, that way it would perhaps reduce the need for as many officers to join the meetings, and that would free up some officer capacity, because I do think that today's meeting has been fairly reasonable in comparison with some of our meetings, but I think the last one ran on till well into the early evening. So I think just from the point of view of managing the agenda and also managing to fit in everything, I do think we need to start scheduling more meeting dates going forward.
Well, indeed, and obviously that's one of the areas for discussion under the review of standing orders and governance, etc. as well. And I think certainly going forward and into 2021, then I would like there to be more regular meetings so that we can cover the areas of responsibility that we have fully. So yeah, I'm in broad agreement with you, and you just keep up with that refrain of yours. That would be fine. And sorry, one final point, which is the last time we had an IJB meeting on the 29th of May, it was a glorious sunny day. Today it's a glorious sunny day. So look forward to a lovely sunny day on the 23rd of September with any luck. And I hope you all enjoy.
Gloriously sunny in Highland Perthshire. I'm not sure. I don't know what it's like in Aberfeldy, but it's not gloriously sunny here.
Okay, thanks very much, and good afternoon, everyone.